period started when the government prepared itself for any eventuality or anything like that. So unlock period then started. But in the unlock period, we saw that people are not now. Somebody has unmuted. And the unlock period, when it was started, people started coming suddenly on the roads, and the roads were jammed with several visits of the people. And it was something like they were trying to stop all the prohibitory norms and everything like that. So again, our Honorable Prime Minister announced the launch of campaign for COVID appropriate behavior. And just after the announcement on 8th itself, Madam Manju Sharma'ji, our past Honorable past President, she took a note of that and immediately informed our Honorable President, Professor Padmanabhan sir, to start a campaign also, to be a part of that campaign also. And the NASI also started with the oath taking, and then several programs were formulated, and all the chapters and all the fellows and members were informed about this program. And now that is why we are here on this day to launch this program formally from the headquarters of the NASI. So we welcome everybody, and now to start the program, I would, with the permission of the Honorable President, I wish to invite for the welcome address Professor Manju Sharma Madam, the former Secretary to the Government of India, Department of Science and Technology, the past President and the Chairperson of the NASI New Initiatives, under whose guidance, overall guidance, this program has been launched today in the Academy. Although several chapters have also started the program, they were informed by Madam and our office also. So many have joined this movement, this campaign, and this is the vision of Madam, that she immediately gave a response to that call and make a beautiful plan how to launch this and make it a mass campaign. So we are very much grateful to Madam and request Madam to say a few words as the formal welcome address.
Thank you. Namaskar and very happy good morning to all the distinguished participants. I extend a very warm and cordial welcome on behalf of NASI to all of you, and especially thanks to Professor Balram Bhargav. In spite of his extremely busy schedule, he agreed to inaugurate our program. I also want to thank Professor Padmanabhan, Honorable President, Dr. Katoch, I welcome him, and Dr. Sinha and Dr. Tandon, all the very distinguished speakers for this program. All of you are aware that NASI, as per its mandate, is committed to take the message of science and technology to every strata of the society. NASI has been doing this for so many years now, more than 2-3 decades, creating awareness amongst the people and sensitization of programs which relate to healthcare, food, nutrition, employment generation, environmental safety, etc., etc., have been one of the major activities of NASI over this period. Therefore, NASI will make every possible effort to take the message regarding the COVID-19 pandemic to the people, especially in the rural areas, for their protection, prevention of the disease, etc. It is also our earnest desire to inform the young students and the young scientists, as well as the younger generation of this country, about the seriousness of this pandemic, and we have to take very simple measures to protect it, as has been already given in the Sandesh from the Prime Minister when he addressed the nation on 20th October. And in very simple language, बहुत सहजता से उन्होंने समझाया, जब तक दवाई नहीं तब तक ढिलाई नहीं. बहुत ही आसान तरीके से कह दिया। और उसके बाद जो उन्होंने जागरूकता अभियान में तीनों चारों इम्पोर्टेंट स्टेप्स कहे हैं, वेयरिंग ऑफ द मास्क, सोशल डिस्टेंसिंग, 2 गज की दूरी, and cleaning hands with soap. So these are very simple steps, but we can prevent this pandemic to very great extent once we take all these measures. This is what we want to convey to society. We also want to emphasize on hygiene, sanitation, nutrition, all essential for the well-being of the people during this difficult period. Once again, I want to thank Professor Padmanabhan and Professor Balram Bhargava for being here, and over to Professor Bhargava. No, I think Dr. Ajay Pathak will speak for a few minutes, then to Professor.
Sir,
Is that
Madam,
with you?
Madam, inaugural address is to be given by Professor Bhargava, sir.
Yeah.
Just now, before that, I would like just to introduce, although he doesn't require any introduction, but I just wanted to pay regards and also say thanks to him because he has led this program so well in the whole country that today's actually the picture, which is 91% are recovering from this pandemic, and we are having very good status in comparison to the other countries if the population ratio is also being considered. So many things have been done by the ICMR and his group, and he is fellow of our academy. He is also the fellow of many other academies, a very distinguished scientist, and an innovator of a very high esteem. So I request Professor Bhargava sir to say a few words as the inaugural address. Thank you, sir.
Thank you so much, Honorable Dr. Padmanabhan, Dr. Manju Sharma, our friend Santosh, and Neeraj, and Dr. Mr. Khatak. What I will talk is, I will first put a philosophical aspect. I hope everyone can hear clearly. Yes, okay. So first I'll put a philosophical aspect to this pandemic, and then I'll try to see how India has fought back to this pandemic. I will take 15 minutes of your time with your kind permission. See, now this century has seen, and from the beginning of this century or this millennium, we have seen outbreaks of SARS, we have seen outbreak of MERS, we have seen outbreaks of Nipah twice, we have seen Zika, and we have seen Ebola, and as well as this current pandemic, which has happened across the world. We are seeing that they are more frequent and they are more complex. The disease is getting more complex every time. And the reasons are because of the fact that there has been a change in environment in the whole world. There has been an ecological change. There has been rapid urbanization. And there is extreme connectivity. People could travel very fast. Airlines were busy and we were moving like anything. So extreme connectivity was there. And the public health spending in the whole world had reduced across the world. So public health spending. So these were the reasons which are actually responsible for the pandemic, which is more than what we have seen in the last 20 years. And we are going to see more unless we seriously think about our ecology, our environment, and urbanization, global warming, and other issues. Now, coming to this pandemic and the fact that India's approach was actually a very proactive and a preemptive and a calibrated, science-driven approach with more of a whole of the government, whole of society approach, and led by a very strong leadership. We stuck to the basic principles of 5 T's, which are test, track, trace, treat, and use of technology. We did not sway on the other side at all for herd immunity. We did not flirt with herd immunity at any point in time, like many countries did and faced the problems. Sweden faced that problem, United Kingdom faced that problem, parts of the United States faced that problem. So we did have the advantage that the pandemic began slightly later in India, and therefore we took the learnings from these countries and did not at all get tempted by working on the concept of herd immunity. So ours was basically the 5 T's, and we continue to work on this philosophy for the next few months or till we are able to break the chain of the virus. So I will share some slides and then I will start. Can we put the slides here? Yeah, this one. This one. Yeah. इसको full screen कर सकते हैं? Can everyone see the slides?
Yes.
Yeah. So now India's fight against COVID and how we have tried to work from ICMR with the science ministries, with other ministries, and as I said, it was all of the government approach. Now today we have 42 million cases across the world of COVID-19 and 1.1 million deaths. And in India we have 79 lakh cases with 1.2 lakh deaths. And the strategy of the government of India, as I mentioned, has been test, track, trace, treat, and use of technology. Now, testing was the most important pillar, and therefore we had to start with testing. We had just one lab, that is the NIV Pune, and we also had a small viral research laboratory network, which was started with the offices of Professor Katoj at that time when he was DG ICMR, and that was after the SARS epidemic, when samples were sent out of India for testing to the United States CDC. After that, the Viral Research Laboratory and the BSL-4 facility in Pune was established, and we were able to do the testing. We had the philosophy of having a laboratory in every district of India, and we created 14 mentor institutions throughout the country, which you can see on the left. And we had the basic prerequisites of the lab that needed a RT-PCR machine. We had a functional BSL-2 laboratory. We needed a proper waste disposal policy, a cold centrifuge, functional autoclave, consumables, and also the staff was trained for molecular virology in all these labs. And we also tried to set up labs in the Northeast region and in the high, tough terrain regions like Ladakh and Leh and Kargil, and also in all the 7 states of the Northeast. We also harnessed the government medical colleges and set up labs in the government medical colleges, and passed in a gazette notification that medical colleges may be de-recognized if they do not set up a virology lab. And this was approved by the Ministry of Health. And out of the 281 government medical colleges, we have labs in 273, and 185 out of 261 private medical colleges have labs. And now out of the 739 districts, we have labs in 650 districts, and the remaining 89 districts have a lab within 6 hours of driving distance. So initially, the phase 1 was to set up labs in large cities and urban areas, and we set up the RT-PCR labs. We innovated for the district level in the phase 2. We thought about setting up molecular diagnostics. So we repurposed the TrueNat and CBNat, the tuberculosis molecular testing, and we set up these labs in various districts. And currently, we have 2,500 TrueNat machines across India as molecular diagnostics, started in April for COVID-19 testing. And the BBC and UK have just started molecular testing last month by their machine called DNA Nudge. And we have had the TrueNat since April, and 2,500 of our machines. And the Lancet has praised how across India we have set up these 2,500 labs at the district level with a short turnaround time and rapid testing. Then the third thing that we did was at the field level, we set up the rapid antigen testing in the field level and in rural areas. We started rapid antigen testing in early June, and this got WHO pre-qualification only last week, And now the United States has also adopted this rapid antigen test for testing. So this has also been a major thing in our armamentarium. We encouraged the startups to set up and indigenous companies to start manufacturing. Initially, importing all the kits, whether it be the RNA extraction kits or the viral transport or the RT-PCR kits. And the price was anywhere between 1150 rupees to 320 rupees for the each. So 1150 plus 320 plus 320. So it's nearly 2000 rupees for one RT-PCR test. And that has gradually gone down from March to August to 138 rupees and 91 and 94. So about 300 rupees, we can do a proper RT-PCR test, and all the tests are available with GEM. We have validated about 1,000 kits, which are 185 VTM kits have been approved, out of which 173 are indigenous. RNA extraction kits, 87 are indigenous, 228, and rapid antibody kits, another 12 are indigenous. Rapid antigen kits, 5 are indigenous and 10 have been approved, and the ELISA kits, 16 are indigenous. So this is how we have calibrated, and the government has worked, and now we are exporting to many countries these diagnostic kits because they compete very well with international prices, and we are able to market them to many parts of the world, including Europe as well as Africa, and the MEA is helping us in set these kits too. So about 1,000 manufacturers, and they're all now on GEM. Now, laboratories, we had non-ICMR laboratories. We were able to set up the laboratories of the DRDO, DBT, CSIR, DST, and we had around 45 labs out of 2,040 labs belonging to these central institutions. 40 labs have been set up by these institutions. We have also asked NABL for accreditation, and we have for quality control and control, we have these labs all across India, which are ICMR as well as non-ICMR labs, and you can see them all across on the map of India. Now, then there was an important mission, which was Mission Lifeline Udaan. Now, during the lockdown from March 24 to May 31st, there was a total lockdown in India. And here again, I want to emphasize that the lockdown that we had in India was very much different from the lockdown that they had in China, which was really a draconian lockdown. And on the other end, we had a lockdown which was in Europe and USA, where people were not even obeying the procedures. So ours was somewhere in the middle, which was quite a calibrated lockdown. And during this lockdown, the Ministry of Civil Aviation, Indian Air Force, in partnering with Niti Aayog, Ministry of Law, Ministry of Railways, Department of Personnel, Indian Revenue Services, used to fly helicopters and flights at night. And ICMR was working 24/7 for the last 6 months with arranging for kits, arranging for the consumables, and packaging them, NIV, and all these, the 14 depot centers that were created throughout the country. And flights were arranged overnight, and they were sending them to various labs, and special flights were commissioned, and packages were rushed to various parts of the country. This was a tough time, but it helped set up these labs. And this was the Mission Lifeline Udaan, wherein the Indian Air Force really helped us tremendously. In terms of testing augmentation, we were doing 10 tests per day in January, and now we are doing more than 12 lakh tests per day as we speak on 30th October. And if we look at this on the left, if we compare with various countries in the total number of tests, we are second only to the United States. And then we have much lower down is Russia, United Kingdom, Turkey, Brazil, South Korea, and much lower down in terms of the total number of tests that were being done. Now, this testing capacity in terms of the labs, we have gradually increased our labs. From April, we had 150 labs, and now today we have 2,030 laboratories doing more than 10 crore, 90 lakh tests for testing. Our testing strategy was also very calibrated depending on how many labs we had, how many kits were available, how much we could test at that particular point in time. Initially, in the month of March, it was mainly travelers, healthcare workers, and contacts. Then we increased it to clusters and ILI. We started a new concept of pool testing, where the percentage of testing was less than 2% in remote areas, rural areas. When we got from the Sero survey that it is only 0.7% in the whole country, then we said that pool testing could be allowed in rural areas, and more than 20 samples were, and that helped tremendously. In May, we include hospitalized patients, migrants, returnings, and also in June, we started the OPDs and surgeries, pre-surgery testing, and for immunocompromised patients. And later on in September, we included pregnancy, high-risk people, and then now it is really on-demand testing, and anyone can get testing done, and we have enough facilities for the same. We are ensuring that 90% of the turnaround time is within 24 hours. However, that is one of our mandates, which we're still not able to achieve, of getting 100% turnaround time of 24 hours. Although the Delhi High Court has clearly told us that the turnaround time and the report should come within 24 hours, because this is very important in isolation and tracking the contacts of those patients once they are tested positive. We had an inventory dashboard for demand forecasting, and we had national depots. We created 20 ICMR depots in 20 of our ICMR institutes, and they were working 24/7 with special teams to enable information on stock out status, lab requirements, and suggesting dispatch quantities. And this was launched in April, and these have been working again 24/7 to supply kits to every state and every laboratory. We had a data entry portal which was made again in March, and this is the most trusted portal for the Ministry of Health and the Government of India in terms of positives and negatives. And this is how this has been started. We have a dashboard, and we have the information, the diagnostic labs and the national testing database, and we share it with various ministries and the NIC, NDMA, Disaster Management Authority, and Ministry of Health and Family Welfare for disease trends, for policy making, for resource planning, and for clinical decision making. Now, the capacity of assessment of labs and matching procurements have been done depending on the type of machine, types of stock mix, operating hours, having 2 shifts, having 3 shifts, and streamlining procurement with robust projections and testing commodities, tendering platform, and we made sure that out of the 1,000 kits, most of them are now available on government e-market and are on GEM, and our tendering platform of Government of India was used and fast-tracked, and for vendor registration and also for procurement. So this has also been streamlined in this few months. Indigenous development, I talked about the 1,000 companies that have been validated. We have also developed the indigenous ELISA kit, which was the very first one developed in April and was used for the Sero survey, which predicted that at that point in time, the Sero prevalence was 0.7% in April across India, and that was used to check presence of IgG and COVID infection in the past. In terms of research guidelines and advisories, we have various advisories on ICMR website. We have been helping with the Ministry of Health website. We have been doing press briefings regularly, and 3 dedicated issues of the Indian Journal of Medical Research have been published, first online and now the full articles, and the 4th issue is in press, and articles are also flowing into that, and we are doing them a very fast track, and this whole office again has been running 24/7, getting them reviewed very fast. We developed a national task force, and we informed this task force to the Supreme Court of India as well, with the roles and responsibilities of calibration of testing strategies, advice on lockdown and containment strategies, develop advisories regarding discharge policy and treatment, provide oversight for all ongoing research, recommend clinical trials for drugs and vaccines, explore newer treatments and repurpose drugs, and develop clinical management protocols. And we have had various subcommittees under this national task force, which has been helping us in terms of development. Now, coming to the most important aspect is the development of the vaccine. We have a private-public partnership with Bharat Biotech. We isolated the SARS-CoV strain, and we were the 5th country to do so in the month of March. We provided this strain in the month of May to Bharat Biotech, and then they developed the inactivated whole virion candidate BB152 or Covaxin, The candidate was characterized at ICMR NIV Pune, and preclinical studies, small, large animal, including non-human primates, was done on a war footing. We had to get permissions from the CPCSA, Animal Ethics Committee, capture animals. I'll come to that when we talk about them. We did the phase 1-2 trials have been completed. The phase 3 trial permission has been granted and they start next week. And we are also proposing clinical trials with this vaccine to be done in neighboring countries like Bangladesh and Myanmar, and also in the Middle East. Qatar has approached us for the same. So the preclinical study on immunogenicity, safety, toxicity of BB152 was done day 0, day 7, day 14, day 21, and day 28. And we measured we found that it had excellent safety profile in all the 3 species and high neutralizing antibody titers at 3 micrograms and 6 micrograms. We tested 3 doses, 3, 6, and 9, and we found that the adjuvant also induced Th1 based antibody response, and this has been it's still under review at Nature Communications, and the preprint is already available in the Nature Communications. We did a hamster challenge study with the virus, and again up to day 57. This was started again in the first week of June, and the samples were collected at different time points up to 57 days after virus challenge. And there we found robust humoral response in group 3 and group 4, where 3 and 6 micrograms with adjuvant B were used. And Th1 based immune response was also found in both these. And rapid viral clearance and the upper and lower respiratory tract was found in these hamsters. And this is again in Science Cell Press is under review, and they have put up the preprint version. Now, coming to the non-human primate challenge study, the work was started in June. We got all the permissions on a fast track basis. We captured the monkeys, we isolated the monkeys, we tested them for presence of any disease. We did the IGRA test, we did the x-rays, we procured an x-ray machine with the tuberculosis testing, we procured bronchoscopes, and we did their challenge. They got them the first vaccine dose, the second vaccine dose on day 14, and at day 28 we gave them the virus challenge, and at day 35 necropsy was done, and samples were collected from blood, nasal, throat swab, bronchoalveolar lavage that was done by bronchoscopy. We had a respiratory specialist flown in from our institute here to NIV Pune, and he did the bronchoscopes. And then we were able to demonstrate very good neutralizing antibody response in 3 and 6 microgram, and helper T cell response again in 3 and 6 microgram, and complete viral clearance from body fluids and organs on day 35 in group 3 and 4. And this is, as I mentioned, in Nature Communications. In terms of the clinical trials for BB152, we started them in the July. The trial started on 15th of July. And we did the 2 intramuscular doses at day 0, day 14, and then the samples collected at day 28, 0 and 28 days. And we had 4 arms with 3 vaccine formulations in the phase 1. And there we again found a good neutralizing antibodies, and they were safe. And 375 participants were there. And this paper is under review in Lancet. And hopefully we should hear from them by Monday, Tuesday, because they have asked us for some revisions, which we have done, and sent them to them on Thursday and Friday. So that was done on a rapid phase. The phase 2 of this BB152 with 2 intramuscular doses, day 0 and day 28, with 380 participants has completed. They have been given their first dose, they have been given their second dose, and the samples have been collected for and that analysis is ongoing, and hopefully by 3rd or 4th, we should have the manuscript ready for the complete phase 2 results to be sent again to Lancet once we receive the results of phase 1. We have got permission for phase 3, which is 25,000 participants in 22 sites, and has been approved by CGI. And this is going to be, the sites have been identified, and they have the ethics clearances have been obtained, and they are starting work in the first week of November. Now, many countries like Russia and China and other countries have given approval on the basis of phase 1 and phase 2 for healthcare workers and frontline workers, and would depend whether the government gives permission to roll out the vaccine, although the preparations have been done by a high-level vaccine committee, which has been set up by the Cabinet Secretariat under Dr. Paul and the Health Secretary, and I'm a member of that committee, and we have been meeting every week for the last 8 weeks, and we are discussing all the logistics and have been able to get the logistics ready for cold chain as well as the vaccine, all the aspects of vaccine deployment and the prioritization, how we are going to do it, which subsets first, and from January to July, how we tentative plan is from 1st of January till July, but we may be able to get, if we get emergency use authorization, we could even start earlier. But this phase 3 trial will take at least 3 to 4 months before it is completed if it starts in November. And if we have to wait for phase 3 results, then we will be delayed. Now, in terms of other vaccine development, we are working with the Serum Institute, and we are doing the phase 2B3 trial, and we have funded it fully from ICMR, the phase 3 trial for the ChAdOx vaccine or the Oxford vaccine. It is ongoing at 16 sites and it's progressing well. But this is only a bridging study, and the approval for the Serum Institute will happen once the phase 3 results of the Brazil, the American, the South African, and the UK studies are pooled, and we get the results, and they are saying that they should have them by December. So if their results, they are going to wait till December, then the Serum Institute or the Oxford vaccine will get approval for use in January unless we get emergency use authorization. There is another vaccine which is performing very well, which has been licensed to Serum by Novavax, and we are helping them with their clinical trials. We have also set up the National Vaccine Portal on the ICMR website, which has all the evidence available for various vaccines, including the COVID-19 vaccine and the BCG, etc. In terms of the BCG, we have started a large trial on BCG on 1,400 patients, in elderly patients, whether we can revaccinate them 60 to 80 years of, and we have completed 1180 vaccinations, and we did an interim analysis of about 80 samples at 1 month follow-up, and we found increased total antibody levels was increased and it enhanced the innate and memory cells, both T cell and the dendritic cells in these humans, elderly patients, and we are looking at their results more carefully, and we can see these are the 9 sites of the BCG trial, which will complete enrollment I think in 15 days time, and we will look for their follow-up. We also developed equine sera, hyperimmune globulin sera, where when we did an expression of interest in the month of June and asked various companies for whether they need our virus and they can control that. So we supplied the virus to several companies, including Biological Evans as well as Kasoli, but the Biological Evans was able to develop the neutralizing hyperimmune globulin, and we did have some hamster studies on that, and we are looking at that, and they have probably got now approval for phase 1 clinical trial in a limited number of patients, but whether that will show much promise or not. We have also worked with the DBT ICGB Institute to develop monoclonals with the Emory Institute, and we have developed some monoclonals, but whether they will reach the humans will take some time before we get some animal studies done on them. Now if you look at where the randomized trials have been done for COVID-19 across the world, so only 3 or 4 trials across the world have demonstrated largest randomized trials have been done. One is the recovery trial in the United Kingdom, which has clearly demonstrated that steroids and dexamethasone is beneficial in COVID-19. That was one large trial across the world. The second was the WHO Solidarity trial, which I will come to. And the third is the convalescent plasma randomized trial, which was conducted across 39 hospitals in India with more than 350 participants, 464 participants with 350 authors. And this was published in the British Medical Journal. The study was started during the lockdown in 22nd April to 14th July. And we gave convalescent plasma in randomized basis. In 235 plasma was given, and in 229 saline was given, and we compared and clearly demonstrated that this convalescent plasma is not using mortality in severe or moderate cases and not preventing the progress of moderate cases to severe cases as well. And this is the largest trial, and the British Medical Journal has two editorials praising Indian science and also commending that Indian science has been democratized, and different hospitals in the country have been able to work together in this pandemic and have demonstrated. Following this massive trial, we've been approached by NIH, we've been approached by the NIAID for conducting trials on monoclonals, which we will start very soon, and many Indo-US trials are starting on this. This is the WHO Solidarity Trial, which was again a 30-country trial in which the 10% of the patients were from India and was led by ICMR Nari Institute. And we demonstrated that remdesivir is not working as compared to control. Remdesivir is not useful and as an antiviral. So most of the drugs that we felt were working are not working, other than mask, other than oxygen, other than steroids or cortisone, and regular testing, tracking, tracing has been probably the only thing that has worked. We did the National Sero Survey. We did one of the largest sero survey in the world in the month of April, and again in the month of August. And we are planning to do the third sero survey in the month of December, which will help decide our vaccine dissemination. And this was done by 24,000 subjects and 28,000 subjects. And we did this was done during the lockdown in May 11 to June 4, and this was done recently. And many of the ICMR institutes were able to immediately provide full caliber, so that they were able to do it in 70 districts across 10 villages and collect blood samples. And we demonstrated that in the first sero survey, the prevalence was 0.73%, and in the new sero survey, it is 7% prevalence, which is 4% in rural areas and 7% in urban areas, and 15% seroprevalence in urban slums, and highest is 15% in urban slums. However, there are certain smaller sero surveys done by different cities, Delhi, Bombay, Ahmedabad, and they have gone up to 25 to 30%, but none of them are near 50 to 60%, which at least 60% that we need for herd immunity. We have looked at all the data. We have 100 million tests that have been done. We looked at the data of the 100 million tests over the last 6 months, and we demonstrated that we had 40 cases of reinfection in India compared to the earlier 6 that were described in Brazil, and 24 have been described across the world, but we have now recently demonstrated 40 cases, and we have sent this paper for publication in the Journal of American Medical Association. New initiatives, we have biorepositories in different parts of the world, and also we have developed a clinical registry which is tracking down patients who are admitted, looking at what their treatment is and what we have learned from them. So there has been a partnership with all the scientific departments, whether it be the DBT or DST or CSIR or Ayush or ICAR, MHRD or IITs for validation of kits, antiviral screening, repurposed drugs, Ayush regimens, textiles, products, validation of devices, mobile applications, biorepositories, and indigenous vaccine developments. And we've had this very strong leadership with the Cabinet Secretary and the empowered groups and the National Task Force and the Ministry of Health and Family Welfare, with the Center for Health Informatics, the drug controllers, the state governments, the Emergency Medical Relief, National Accreditation Board, the NCPC, other science ministries, and the National Information Center as a whole of government approach as far as the health part is concerned. And then for various things, whether it be for oxygen deployment for the whole country, or for the setting up of oxygen plants in various hospitals and district hospitals, for PPE manufacturing, several companies now we are exporting, and the various ministries, whether it be textiles or DPIIT or others, have all helped tremendously as a whole of nation approach under the strong leadership of our Prime Minister, as well as the fact that we have been all working together to fight this pandemic. And fortunately, we have done well in the last 1 month, and the number of cases have dropped by 50% since the middle of September. However, Three states are not performing well, and the cases are on the rise, which are Delhi, West Bengal, and Kerala. And there again, we have emergency meetings day before yesterday for them to ramp up their testing, tracking, and tracing. More importantly, the contact tracing part, we have been doing their testing, but we have not been doing the contact tracing. Although we have done the contact tracing of up to 15 people per tested positive in Delhi, we have also not been able to isolate them. So the spread of infection has been there. But most important, till such time that we have a vaccine, and even beyond the fact that when we have a vaccine, we will need to use the mask because the mask is working very, very well. And we have found that with the cold weather, with the air pollution, with the pandemic progressing in certain crowded cities, as well as festive season, elections in the neighboring states, we will see a spike, and the use of mask is very important. As we have seen that people, it has to be a new normal that we continue to wear mask wherever we go, and mask will probably be the last to go. Even when the vaccine has come, even when the pandemic has gone, masks will still continue to be worn. Like in countries like Japan, in Tokyo, when they had high pollution, people continued to wear masks, and it has become their norm and culture in many parts of the Far East. And that is why we have found that the epidemic has been much better controlled in the Far East because of the use of masks as a cultural thing. And I would really like to emphasize that the use of masks has to be emphasized at every level. And I congratulate NASI for doing this seminar to promote the use of masks and the Jan Andolan of Do Gaz Ki Duri, as well as washing hands and maintaining the COVID appropriate behavior. The most important part is that appropriate behavior does not cost anything. It is zero cost. By maintaining distance or washing hands, it doesn't cost anything. And the cost of the mask is also negligible. So I think this is the most cost-effective program. And once we have the vaccine, it will add to the benefit that mask is giving. Masks plus vaccines plus some antibody response, maybe hopefully we can have a very small number to be able to test, track, and trace in the middle of next year, so that we all add up with these three things. So I wish all the best, and thank you so much for your giving me this opportunity. Thank you so much.
Thank you, sir, for a very nice, informative, and a very illustrative lecture, which has opened the mind of many who are listening, especially regarding the mask is must. Mask is must, and that is the solution which is being provided now, apart from the social distancing and the hand wash. And also emphasizing on the 5 T's, the tracing, testing, and treatment, and other things, and also giving a clue about the vaccines, that what is the new status of the vaccine these days, and for overall for leading this movement as a very dynamic leader. We are very much grateful to you for this time. Thank you very much.
May I ask a question? Am I allowed to ask?
Hello.
Hello, this is Amit. May I ask a question?
Yes, sir. Yes, sir.
Professor Bhargav, I recently read a report, a study done in Netherlands. They say that influenza vaccine is somewhat protective. What is your comment on that? Do you have any such information in the country?
The mutation of the virus?
Say the flu vaccine is somewhat protective.
No, the flu vaccine, there is some scientific plausibility in the flu vaccine being effective because they are of the same family. However, there is not much data to show that the flu vaccine is protecting against this virus. The flu vaccine it does boost the immune response in terms of T cell and B cell response. But specifically against COVID-19, we do not have much data as of now. Just to put things in perspective, we had some live attenuated virus deaths in Korea, 42 deaths with the flu vaccine in Korea just 2 weeks back. So overuse of this flu vaccine. Currently, the flu vaccine, at least in India, is recommended for people above the age of 65 or those who have heart failure or respiratory disease only. Although it is being used in the United Kingdom and the United States for the entire population, but they have not been able to show that numbers epidemiologically.
Okay, thank you very much.
So, Professor Balram, I'm Dr. from AIMS. Good morning. Excellent lecture. Very nice. Sir, I have one question. Plan for supply chain after once you get the BV-152 vaccine. What is plan for the supply chain, and is there any priority for high risk group of healthcare workers?
Yes, I think this has been prioritized by the NEGVAC committee, which is the National Vaccine Committee, headed by Professor Paul, and they have debated on it. They have looked at the numbers of people, numbers of healthcare workers. They have done all the homework with the Health Ministry of all the states, with the Home Ministry, and look at what are the frontline workers, how much are the elderly population, what is the comorbidities. So the prioritization has been in the following, but it is obviously a moving target for healthcare workers, followed by frontline workers, followed by elderly above the age of 65, followed by people above the age of 50, which includes more than 80% of people with comorbidities. So if we have people above the age of 50 vaccinated till by July next year, which is the plan for the government, say 30 crore population, and that is again being calibrated by the vaccine production as well and the supply chain. If we are able to vaccinate 30 crore population by this prioritization, hopefully we can break the virus chain along with the use of the COVID appropriate behavior.
Yes. Thank you very much. Thank you.
Thank you, sir. Now we are coming to the opening remark, and that is by Professor Ajay Ghatak, sir, who is the chairperson of Delhi chapter, as well as a very learned person and scientist, eminent scientist known all over the world, especially for his work in physics in the area of light and lasers. Sir, as during this pandemic period, actually when we were trying to correlate and coordinate with many other institutions, sir initiated this work and he coordinated with several institutions of India as well as world to make the things visible on the video conferencing sites and organized hundreds of lectures during these last 6-7 months, and it is his dynamic leadership that the chapter is also doing very well, and NASI is proud of his chapter. I request you, sir, to please deliver your remarks.
Thank you. Thank you, Neeraj. Can you hear me?
Yeah.
Sir.
Can you see my
Yes.
slides?
Yes, sir.
All right.
It is to be given the full screen. Okay,
Yeah.
sir.
Is
Thank
it all
you.
right? Thank you very much for giving me this opportunity. And I thought I will just share my views, my experience in my learning process in using distance learning during the COVID crisis. First of all, I would like to congratulate Dr. Manju Sharma and her team at the NASI headquarters for taking this great initiative and organizing several very important seminars which are very relevant to the COVID crisis, including this one on. Really, it is a great initiative. But before I start my lecture, I must express my deep, very deep sense of appreciation, and to a certain extent, I'm amazed to hear the lecture by Professor Balram Bhargav about the extensive work that is being carried out in our country. Professor Bhargav, we are very, very proud of what you are trying to do for this great country with 1.4 billion people. And it must have been a tremendously difficult task. But you are doing this and also participating in lectures like this and sending research papers. It's really amazing. I was just amazed to hear your lecture. And I felt, as many of my colleagues have said, that this lecture should have been broadcast throughout the nation. Dr. Paramjit Khurana mentioned in the chat box that this should have been broadcast throughout the nation as an education process, that what all we are doing and what all we are trying to achieve. I can only give you my very best wishes for all success in your endeavors. So, as we have seen, and as we read every day, associated with the COVID crisis, we have severe medical issues. We have severe employment issues. We saw that tremendous migration and then return to work. And you see in this photograph, only 10% of the people are wearing masks, not even 10%. And that's a shame. That's a thing that worries me, that a mask which costs so little and most of us can afford, but in this huge crowd, there are very, very few people who are wearing the mask. And associated with the COVID crisis, we have also serious mental health issues of medical workers and other people associated with it. And sometimes we do not get the attention of the doctors as much as we expect to. But we must realize the fact that the entire medical industry is in so much pressure. And I hear that in some hospitals, they are not even getting their salaries. So that is something that we all should be at least aware and have compassion for that aspect. But the solution, as has been mentioned by Manju Sharma and also by Neeraj and everyone we know, but the solution is very simple. And so we should be more responsible for coming out of it, because this coronavirus is going to stay for a long period of time, in spite of the tremendous efforts of people like Professor Balram Bhargav. It is going to stay, and we have to observe these for maybe 2 or 3 years. And here is a photograph that someone sent me. There's a huge crowd. And as you can again see, there are 10% of the, it's a little humorous in this serious situation. I thought there is, in this huge crowd, you can see that there are only 10% of the people wearing masks. And this gentleman is playing the flute. So the caption, which was in Bengali, said, and I have tried to translate it, I know the person playing the flute. Our acquaintance is from my previous birth. He was playing flute on the deck of Titanic, and then also we drowned together. So you see the irresponsibility of the person playing flute, and so we must become more responsible citizens of our country. So we should just be responsible citizens and follow simple rules. So actually the initiative was taken not by me, but by my younger colleagues associated with the Delhi chapter, who said that the colleges and schools have closed. So we have focused only on colleges, at the college level education, how we all can contribute to the fact that all colleges are closed, and we can use this technology, this tremendous technology that we have at our disposal, to distance learning. So one of the things that was organized, the Delhi chapter organized an 11-week course from July 27 to October 11 on learning physics. So every day from 5 p.m. to 8 p.m., 3 very senior faculty members, mainly from Delhi University, Delhi University colleges, Calcutta University, Banaras University, and other people, we contacted large number of people. And every day from 5 p.m. to 8 p.m., we organize lectures for students. Initially, I was myself very apprehensive that such a thing can go on. But these two ladies, Dr. Punita Verma and Dr. Pushpa Bindal, Dr. Punita Verma was the main convener and Dr. Bindal was the co-convener, both associated with the Kalindi College at University Delhi. They, along with their colleagues, have done a phenomenal job. And I thought I should bring across to the entire NASI family. So the total, somehow this, on the right side, there is a total number of 1 hour lectures delivered were 145. And total number of subjects covered were 14. And total number of faculty that were involved were 43. And we had courses on classical mechanics, electromagnetic theory, statistical mechanics, nuclear and particle physics. Professor Brajesh Chaudhary is the head of the physics department at Delhi University. And then we had waves and optics and quantum mechanics, mathematical physics, electronics, and solid state physics. So this was really a phenomenal course of lectures. People went out of their way to prepare, and then atomic and molecular physics, and people from ICER Pune, University of Delhi, TIFR, they all joined in. And it was a spectacular thing. And then the coordinators have put all the lectures on YouTube. And they are now available on YouTube. If someone wants to have access to that, if someone wants to have all the links, they can write to me, maybe to Dr. Punita Verma. So on 11th October 2020, at the valedictory function of the program, many students became very emotional, and some of them started crying and said that they were so used to, so eagerly look forward to the 3-hour lectures every afternoon. And then during June to October 2020, NASI Delhi chapter, in collaboration with Deen Dayal Upadhyay College, University of Delhi, organized 27 special public webinars by outstanding international and national experts, which included 2 Nobel laureates. Usually to organize a special lecture, there's so much of expenditure which is involved, including tea, coffee, lunch, and airfare and things like that. But now we have the technology to do that. And this was very beautifully coordinated by Dr. Manoj Saxena and Dr. Deepika Jain, and both faculty in Delhi University colleges. And we had popular science lectures by Nobel laureates. We had 2 Nobel laureates who very kindly agreed, and they gave 1.5 lectures, and they were so relaxed. It was such a pleasure to interact with them. The Nobel laureate William Phillips and Nobel laureate Jean-Marie Lane. And then we had lectures on astrophysics, and then on molecular physics, biology, and popular science. And it was really overwhelming. I have been wanting to talk to Manoj and even Punita that we should provide some kind of honorarium, not money necessarily, but a token of respect to all of them who went out of their way to speak at night, because for them it will be 10 o'clock in the morning and it will be 10 o'clock at night here, or 10 o'clock at night there and 10 o'clock in the morning here. So these were the lectures that were organized, and then women in science and engineering, and not just in physics. You see, the first part that I described was only restricted to physics, BSc, MSc students, catering to BSc and MSc students. And now we have from biology to medicine to chemistry to physics and pure mathematics. And the impact has been tremendous. Not only students in India have benefited, and that is the greatness of the technology that we have from countries like Argentina, Bangladesh, Singapore, Malaysia, and they have benefited, and they were so happy to participate in that. And when the last lecture was that of a Nobel laureate, and we had tremendous comments that we received. So what I had like to tell you all, that during the COVID crisis, with very little money, we have spent almost no money excepting buying the software for which, so that we can propagate the lectures. We have been able to make significant contributions in distance learning through webinars, which can have very far-reaching implications in future. And so therefore, it is very unfortunate that it was the COVID crisis which made us think this way. But imagine what we can do now. We can have lectures or even teaching to remote places of our country which are deprived of good schools and good colleges, and we can set up such webinars, such demonstrations, such learning process, and educate the most backward sections of the society. It's a revolution that has happened through technology. Through technology. Unfortunately, in India, we are good at technology, but it is also true that around 15 to 20% of our population, or something like that, are still below the poverty line. Still below the poverty line. So how do we remove that? Only through education, only through making them aware that how they can achieve, how they can have a better life in future. And so therefore this has been very unfortunate that we are passing through crisis, and therefore we are using this technology. But it has been a learning experience for a person like myself, that through technology, we can create wonders. We can make people aware how to lead their lives properly, safely, so that they do not get these things like infections and things like that. And also educate. And not only at the college level, but also at the school level. Thank you very much for giving me this opportunity to speak, Dr. Manju Sharma. Thank you very much. That's it.
Thank you, sir, for such a nice lecture. Actually, in NASI, if we say you are the pioneer in making the propagation with the webinars and the seminars, and till date, in last 6-7 months, hundreds of seminars have been organized by you and your team, sir. Wonderful team which has been done by you, including Manoj Saxena and Punita ji and Geetka ji and all others. They are all, their job is commendable. We are very much thankful and grateful.
Thank you.
Now we have also now the other speakers with us now joined, like Honorable Professor V.M. Katur sir has also joined. Our speaker from Allahabad, Dr. Ashish Tandon ji has also joined. He is sitting here. So we are moving to the next part, and that is the part which is very going to be very interesting, as it is being it is to be done by our Honorable President, who is an authority in this field. He is working on several microbiologists, with several microbiologists and the biotechnologists. And the first article came up in March itself, when he gave a direction to whole of the country that how and where we should work to start the technologies for quick vaccine response. And that was a very famous article which was published in International Journal. So we have with us our Honorable President, Professor G. Padmanabhan, and he was Director of Indian Institute of Science and Authority in Microbiology and Biotechnology, world-known scientist. I request you, sir, to kindly give the presidential address.
Thank you, Neeraj, for the introduction. It's indeed a privilege for me to be participating in this webinar. And I don't know how many times we need to thank Dr. Manju Sharma. Any amount of thanking is not adequate because she is the one who pioneers all the activities that will make the vision of the founder of this, reality, taking science to society. And this is just one more example of Jagrukta Abhiyan, where she has put up this effort, and I want to congratulate the entire NASI family, Archana, Neeraj, Santosh, who follow the guidance of Dr. Manju Sharma and make this a reality. I want to thank Dr. Balram Bhargav for inaugurating. I'm sure there's a huge demand on his time, but he not only participated and gave a very outstanding lecture of what ICMR is doing, because you don't get the entire picture from media, misinterprets many things, and he gave the real story. Of course, I have been following it because I chair the technical committee for vaccine funding from the Department of Biotechnology. The very same companies which he mentioned, they are also getting funding from the Department of Biotechnology. There are projects which are, somewhat similar, somewhat different. And I do believe with the cooperation of these departments, definitely more than one vaccine will become available to this country. I only wanted to raise a couple of requests or suggestions which Dr. Bhargava might have considered. One is this cold chain. That is going to be a huge task. One is who will be vaccinated, that is one thing. But the second issue is how do you maintain the cold chain? There are 27,000 cold rooms or whatever in India, which are being used for, India has a universal immunization program, which are being used. And there are several papers on how well these are functioning. So I will not get into great detail, but the point is how the vaccine, because the vaccines have to be stored anywhere between -80 degrees, -20 degrees, 2 to 8 degrees. That depends on which vaccine is going to succeed or which vaccines will succeed. And perhaps I believe India may have more than one vaccine, considering the size, considering the logistics, we may even go for 3 different vaccines. Therefore, the cold chain supply, we may become very, very important. And, there is ice packages, all those things are involved. But there is one important thing. There is a solid state cooling. There are small companies which are coming up with accuracy of plus minus 0.1 degrees. That means there is no ice packing, nothing. But they are all small companies. Is it possible? We really need thousands. We need billions of doses. If a second dose has to be given, you can really think how much we need and how to transport them. I'm sure this is catching the attention of the committees that are involved. But this is one thing, because I look at the vaccine story more closely, I thought this is very, very important that we need to look at this one. Cold chain is a very, very crucial thing. Once the vaccine becomes a reality, that cold chain will become very, very important. But what I wanted to spend time is on the actual components of the Jan Jagruti. That is, what are the 3 components? The first component which we all talk about is the hand washing with soap. this, it is not a rocket science where everybody understands, if you wash it with soap, it's a detergent action and the viruses will be removed. But still, whether it is possible for bulk of the population of this country to use soap washing, even that becomes an issue in a country of this dimension, in the country of, how do we handle this kind of situation? But that is where an institution like NASI plays a very important role. The more and more we spread this message that hand washing in this case is very, very important, I think that will have a tremendous amount of effect, I believe. The second thing which one is talking about is social distancing. Now, before I come to this, I can't but think of my, tradition. When I was 7, 8 years old, we used to be packed to the village where my grandparents lived for a month for summer vacation. And my grandparents were very, very traditional. And they will take bath early in the morning in cold water at 5 a.m. And then wear clothes which they had washed the previous day and dried in the sun. And that clothes cannot touch any other cloth. We call it as muddy in the south, M-A-D-I. And once they wear it, nobody can go near them. You can't touch them. If they touch you, they have to take bath. This is, I do not know. Until their rituals are over, this will go on. Very, very interesting when I look back how these things were happening in their time. And, they will take food on the floor with the plantain leaf. And after the food is over, the floor will be cleaned with a little bit of dung from cow. Does it have antibacterial activity? I have no idea. But that is what they were doing. Even today, if you see in some of the families in South, there is no sipping of water in the glass. Water or any liquid will be poured from a distance into the mouth. Now, of course, my father's generation changed, and my generation completely changed, and I don't have to tell you about my children. What I'm telling is my grandparents. What is it? Unfortunately, we had a tendency to mix it up with religion, with all that. But I do believe there's a huge element of hygiene in all this, what they were practicing. And perhaps we are rediscovering some of these things. But actually, coming to the science part of it, you may be surprised to know there are very large number of papers on social distancing, very large number of papers, and including wearing masks. And I will just tell you about only one paper which is published by a group called SURGE. SURGE stands for Systematic Urgent Review Group Effort. This came in Lancet, June 27th, 2020, by 16 authors from 16 different countries, where they've analyzed 174 studies, not individual cases, 174 studies which have been carried out, mostly from SARS, mostly from MERS, the earlier ones, and also some from COVID, about 600 cases. The conclusion is, if you have 1 meter social distancing, there is a substantial protective effect. 1 meter of social distancing, and 2 meters is much better. But the question is, even that 1 meter, and how this is scientifically based, they actually measure the virus, they sample the air, and then they do RT-PCR, and then find out how much virus is present at various distances, 1 meter, 2 meters, 3 meters, and so on. And we know how the virus is carried. The virus is carried in droplets. And of course, there's a lot of debate whether it's a big droplet, whether it's a small droplet. And of course, they rule out aerosol. These are all matter of debates which keep on going. But the fact remains, the virus is carried out in droplet. And, and it will be at a distance. Therefore, 1 meter of for social distancing would be very, very useful. But, as Dr. Ghatak pointed out, I also have a very interesting joke. Not in Bangalore itself, but one thing I saw in TV in Chennai, there has been an advertisement that a silk company called Kumaran Silks announced sales, clearance sales. And the joke is there is no space for the virus to enter. Means it was so crowded, people were jammed to buy saris actually. So it's extremely difficult in our country to implement social distancing, even 1 meter. Okay, there are jatras, there are things, which, and people, they know probably, but probably they do not understand the seriousness. And therefore, I believe this message should repeatedly go. Keep social distancing. This is, very, very important. At least a meter. More than a meter is good enough. And they need not know whether it is droplets, whether it is aerosol. They need not know actually. So these are, issues that leads us to wearing mask. Now, again, there are several papers, I must tell you, on the mask story. There are many, many papers which discuss about the efficacy of story. That is because in the United States, the guru of gurus, Anthony Fauci, the director of the National Institute for Allergy and Infectious Diseases, Anthony Fauci, in March said there is no need for general public to wear masks. And then in April, he changed the story and then he said it's better to wear masks. So I happened to watch the TV or the video where he was asked, why did you change your stance? You said there is no need for general public to wear. No, I said there is a reason why I said that. In March, there was no evidence that cloth masks will be effective. I thought everybody will be going for N95 or surgical mask. And if that happens, it will not be available for the clinicians. It will not be available for health workers. That is why I said public need not wear masks. But in April, I have evidence that even cloth masks are good enough. May not be as effective, but cloth masks are useful. Therefore, of course, there is a big debate going on whether it should be 3-layer cotton mask, whether it should be 15-layer cotton mask. It will be interesting. And these are all coming in very big respected journals, whether it is Lancet and other journals. I don't know, they may not get published in ordinary time, but a thing like this, everybody is talking about masks. What kind of mask one should wear? N95 stands for 95% of particle is protected. And it is made of polypropylene. It is not of cotton. It is not cotton. Surgical masks, if you read, are not good enough for the COVID story. Best thing would be N95, which probably should be reserved for the health workers. And the general public should wear, I believe, cloth masks. If not 3 layers, at least, minimal. Because I find, at least in Bangalore, perhaps in other places, mask is used like what Lord Shiva has his snake around. They are just hanging around the neck. They don't cover the nose. They don't cover the mouth. I don't know why they are wearing, and like that they are driving. Because I drive to my institute, and I find people are driving two-wheelers, having the mask around their neck. I don't know what purpose does it serve. Therefore, I believe, we really need to propagate this message very, very clearly that masks should be worn properly. There should be a tight fitting as much as possible. It is very, very important. Let it be even a cotton mask. It doesn't matter. But at least the point that should be made, they should be wearing the mask actually. So that is where message comes very, very important. That people should know the importance. People should know the seriousness. Therefore, these are not trivial. Whether it is hand washing, whether it is social distancing, that means keeping the distance between individuals, or whether it is wearing masks. And these are the three main components which the Prime Minister announced. And I think there's a lot of sense in what he said. And I think very, very important that we propagate this message. And I was just wondering whether it can become a corporate social responsibility to distribute masks. The country needs millions, billions of masks, I suppose, and people cannot afford. Whether as part of corporate social responsibility, masks can be supplied, or even soap, small cakes of soap can be supplied. Because we know communities which cannot even afford. Therefore, I believe this would be very, very useful, and NASI has a very important role to play by spreading this message of importance. And I cannot thank Dr. Manju Sharma enough for highlighting this one. And the last point I want to make is one point, what we call as vaccine hesitancy. People do not want to take vaccines in a developed country in the United States. I saw one TV message, 61% do not want to take the vaccine even when it is ready. That is very, that is a developed country, they can do whatever they like. But a country like India, here also we have communities, we have people who do not want to take vaccine. Not that, maybe they are afraid, but more than that, they have very wrong messages. Oh, it will affect fertility, it will affect this, it will affect that. Therefore, in my opinion, that message also should be taken. There is no other preventive that has served mankind better than vaccines. The number of millions, billions of people who have been saved against a variety of infectious diseases is only due to vaccines. Maybe there have been side effects here and there, but that doesn't mean vaccines are useless. Therefore, even when vaccines are available, we have to make sure in a targeted population, all are vaccinated. Otherwise, the entire purpose is not served. You have what are called as asymptomatic cases. So even if one person is not, then they will not show the symptom. They will have the parasite or the virus, and they will distribute it. Everybody needs to be vaccinated. That is where the issue is. So I feel even that message perhaps needs to be useful against what we call as vaccine hesitancy. Vaccine is safe. Vaccine should be taken once every other test has been done. These are the few things which I wanted to highlight. Again, thank NASI for taking up this cause. And we have very good eminent speakers to follow me. And I would like to request them to follow, to give their message on this particular very important topic. Thank you so much.
May I ask you a question, Professor Padmanabhan? This is only.
Yes, Amit, tell me.
I read a paper which said that instead of cloth, if silk is used, is better because silk has a native charge. So even the virus, get stuck there and will not be able to penetrate the barrier.
No, so but virus, virus is not free virus. Virus is in a droplet.
Okay.
So it is a question of size. They are talking, see, there is a bit of a confusion. There is a debate. There are some who say COVID virus is only in larger droplets. I also read a Lancet paper which said most of the pathogens are in droplets which are less than 5 micron. So, but whatever it is, I believe, it is more a size than a charge. Okay. Unless there are also people, I must tell you, who are coating the cotton. There is a company in Hyderabad which is trying to make turmeric coated for cloth. You will know classically, even people who go to Vaishnavi or in Muruga in South, they wear yellow clothes. And historically, the use of turmeric is in a dye. And it's a very powerful anti-infective molecule, anti-infective, this one. So there are people who are trying to coat it with something so that charge may also be playing a role. But the free virus is not there. It is inside a droplet. That's all the point I want to make.
Second quick question I'd like to say is, see, there's a water scarcity in many parts of the country. So even if you give them soap, is it a better idea to, government is spreading so many things, supply with enough number of, enough quantity of sanitizers? Is that a better idea?
It's possible if it can, government can invest. You are right, very right. I was also thinking how much water is needed in every time you wash it with soap and remove. And of course, eventually you will come up with the detergent pollution. That is going to be an issue. Each one has a consequence, So sanitizers would be better, but I do not know whether the government would invest in that. To reach the people, to reach the people in slums. These are the issues. But this is the simplest. In fact, I heard the health minister telling the real vaccine that is working now, these are the three things. Social distancing and, all these are the three elements which are the real vaccine that is working now. We don't know the future vaccine, whether it will work, not work, consequences, all these there. But these are very simple things. In my opinion, it is the worry is it's not one at the expense of the other. It is not as if you can't practice social distancing, you wear mask. No. If we can really follow all the three, I feel we can completely eliminate, somehow I feel 90% at least we should get out of this situation if we can follow all the three. And it's the simplest things to follow. There cannot be things more simpler than this, but I do not know. You are right, Amit. Water is a scarcity. Yeah.
But Amit, there was a study which was quoted I read it in Times of India, that it was one of the Indian institutions made, that sanitizers are not as effective and as good as the soap washing. Soap washing really cleans the hand, and sanitizer is not that effective. So this was in fact.
The soap, definitely we know soap has got detergent action and...
Madam, I was talking about places where, in Jaisalmer a couple of years ago, a boy was so surprised to know that in Calcutta we can open the tap and get water. They will get water every alternate day for 1 hour in the arid season. And at that time, if they have to ask their hands with soap, maybe after touching everything, it becomes very difficult. I mean, I agree with you that there are studies which says the sanitizers are often not as good, but it's just like, cloth masks are not exactly, but some replacement for the N95.
Yeah, that's right. That's right.
Thank you, sir.
Thank you. Right.
We are very much grateful to Professor Palnavar, sir, for giving us once again emphasis on the three methods, that is to wear mask, follow physical distancing, and maintain the hand hygiene. Also, sir has beautifully emphasized the transportation matter regarding the vaccines when it would be implemented, because that also very important, because when we will carry the vaccines, how it would be protected from the heat and dust and all those things. For that, the solid state cooling methods should also be adopted. So all these things are very, very essential for us to follow, and especially the three things which have been given emphasis in the address of the Honorable President also, Prime Minister also. Now we have the eminent scientists as the speakers, and to introduce them, I would like to over the mic to Archana Pantji. She is a young woman scientist, and she will introduce the speakers and invite them. Thank you very much.
Thank you, sir. A very good afternoon to all of you. As we all know that COVID-19 pandemic has not only posed severe threats to human lives, but also to the human spirit. In fact, it has changed the way we live, the way we behave, or even the way we think. The pandemic was declared as public health emergency of international concern from the World Health Organization. And we have also faced such kind of emergencies earlier, as just mentioned by Honorable Professor Bhargava sir, like SARS, MERS. But one of the most crucial aspects in tackling these crises or emergencies is the public response. How the public or the society respond to such kind of crisis very much require a major behavioral transformation, and which means which refers to like changing people's habit or attitude. So it plays a great role in controlling such type of pandemics. But in India, as just mentioned by Honorable President, sir, that in India is very difficult to practice such kind of behavior because of socio-economic problems and also some due to ingrained perception, the traditions, the customs, cultures, and other societal norms. But still, if we spread the message and propagate such kind of message the way we are doing today, it is expected that the entire country will follow until the vaccine is developed. Practicing new behavior, social behavioral transformation, like which we call a new normal or a COVID appropriate behavior, will help a great extent in controlling the outbreak of the pandemic. Now, we will be listening more on this topic from Dr. V.M. Katoch sir, who will deliberate on COVID-19 pandemic, opportunity for socio-behavioral transformation. Sir is NASI ICMR Chair on Health Research at Rajasthan University of Health Sciences, Jaipur, and formerly Director General, Indian Council of Medical Research and Secretary, Department of Health Research, Government of India. He contributed to the development of molecular methods for rapid diagnosis of TB and leprosy. He is a recipient of many prestigious awards and also fellow of all prestigious academies of India, including the National Academy of Sciences. With this very brief introduction, may I request you, sir, to please enlighten us with your thoughts.
Thank you, madam. It's my pleasure, to talk this very inaugural, I think,
We can't see you.
organized by NASI. Madam, I think the problem with my the video. I think so you won't be able to see my face, but I've seen all of you. And if my voice is, heard well, that I think they'll be happy with that because there's a problem with my computer at the moment. Something.
Voice is clear, sir.
Yeah. I think the slides that I requested Dr. Neeraj they have to be projected from your side because I sent them there. So if you project the slides, I'll be grateful. I requested that. I made that request to Archana actually. I think that today's first, they say, but Honorable President Dr. Padmanabhan was saying, all of us we start with thanking Madam Manju Sharma because she's the pivotal person for this entire the story she's building on now, and she has been really pivotal in the lives of many of us for our careers as scientists, as the administrators, and she continues to lead even as the time moves. Her energy, her intuition, her foresight, I think that continues as strong as it was. Again, listening to we started with an excellent talk by Professor Balaram Bhargava, and because belonging to ICMR since 75, I felt so proud and happy that a 110-year-old organization continues to be very vibrant in reaching out to the people, creating a world-class science under a very strong leader. And Professor Balaram Bhargava has set very high standards, which his successors, whenever he's succeeded by, they'll find it very difficult to really match. I think so. Heartiest congratulations to him and the organization. And then, what very nice messages came from Professor Ghatak, Professor Padmanabhan. I listened to them very carefully. And the topic, when I chose this, I thought because of this is looking at a Jagrukta. So let's start talking about the socio-behavioral transformation. And next slide, I think the title need not be projected. You can go to the next, madam. See, this entire pandemic has given us challenges and opportunities. Everybody knows about them. What are the challenges? Challenges are in terms of morbidity. We don't want to huge number of people fall sick, large number of people die, and it has a huge economic impact. So there are three major things which the challenges which the world is facing. But this has provided opportunities at the same time. Opportunities for R&D, for diagnostics, therapeutics, vaccines, appliances, hygiene-based products. They could be disinfectants, there could be equipment also for the home, for the clinics, for the hospitals, masks, so many things. The second, it has given us the opportunities for innovating, developing, and implementation new strategies. The new strategies could be for the disease management at the public health table. It could be for the our working actually, how the people were working during the lockdowns, which you may have the lockdowns again also. It won't happen. You may be forced to do that. And then what performs, what doesn't perform? How you tackle the other diseases when there's a lockdown? How you tackle the other issues which you are addressing? So this number of new strategies, new management practices have emerged during this period for business, for the medicine, for public health, for teaching, how the schools are teaching, how the universities are teaching, how the people are conducting exams, how the administrations are running through the web. And then another one, is the socio-behavioral transformation, which is the very, very important. And I want to share some thoughts actually, which will not be nothing new or what has been talked today, but it will tell my emphasis. Now, if you look at the global community, including India, has responded very well to these challenges. It is not that the world has not responded. Imagine 100 years back when the flu epidemic, last killing flu epidemic was there, 1918, huge number of people perished. Compared with that, the world today has succeeded very well actually. And India has succeeded extraordinarily well actually in containing the spread of the infection to a large extent, reducing the death rate. Now, what has contributed to this? That's what we have to highlight to the people so the people follow actually. See, the first is the inspiring leadership. The inspiring leadership again from the Prime Minister himself directly, and then going down to the Health Minister, other ministries, and everybody. Then very, very hard work done by center and the state governments actually. I've seen how the state governments, their chief ministers have worked. I have a personal experience with a couple of them. Here actually the administrators, everybody. Then the support from the agencies, organizations. Then the people have participated in their own ways, the non-governmental sector, the people, their responses. But what Dr. Bhargav talked about, the massive scale up of the diagnostic facilities. I think the largest, effort ever done by anyone. That and the treatment facilities, again, the government and the non-government also, the private NGO sector, everybody has done it actually. People could come up with a fake ship, hospitals, everything. All that contributed to our success story so far. Now you look at, the response of the political administrative leadership I talked about, the police in the beginning stage, when the initial lockdown, everything started, it was the police-led effort actually. Everybody was contained to their homes, and that gave us a time actually. Police people, they died, but at the time the main savings came from them. Then administrators, doctors, and allied health professionals, as the story built up, sanitation workers, as well as the other stakeholders. It is a stupendous story of, I think an all-round determined response. Now, this determined response and the enforcement actually, very tough when at that time, all the districts used to be under clampdown, the city used to be under a curfew. At that time, there was a fear of death. We are seeing the TVs, from what is happening in Spain, what is happening in Italy, what is happening in other countries, in several parts of the world. But really, after that, the response is slacking down. All of us knowing that, we are talking about that, and that's how we are worried. Now, you look at the past experience, even with the recent swine flu epidemic, that's the time I was at the helm, that showed the deaths. At that time, everybody responded very well, actually. But even the deaths continue to occur. people continue to suffer. One of the former health ministers for Rajasthan died 2 years back. Many people, doctors continue to die even with the swine flu today. But after initial 2 to 3 years, there was a slackness in the development of labs. Also, Bhargav talked about the network created during my period. We had approved as 160 labs across the country with the 10 regional labs. And out of them, nearly 100 came quite fast, actually, during my period itself. First 50 were very easy. Next 50 people were reluctant. The medical colleges didn't want to work, actually. Then they were running away here and there. Even the institutions, infectious disease hospital institute created in Jodhpur, that was stagnant for 10 years. Institutions, hospital infrastructure, all the districts at that time were supposed to have the ventilators and the number of physicians. They're all slowed down. So now what it shared, to keep the people engaged, you need a very different type of a response. And that slackness can even set in today also. So I think that's the question we are thinking, how to keep the people engaged so that, they remain active. Even if the percentage may be small, but that percentage should be fueling up. They should be adding up. They should not go down. Now you look at, the next part. While the developments and use of the effective therapeutics and vaccines, which we talked about, will have certain role in the future management, but we cannot afford to be complacent and speculative. We can't imagine what will come. That what even Dr. Padmanabhan also alluded to. We won't know which one will be there in the practice. We won't know which regimen will be in practice. The doctors like Dr. Sinha will now come after. I think he'll be talking after me. The people have been saved by the clinical expertise, actually. That is how they manage their respiratory system, how they manage their multi-organ involvements. That is why the common sense of the clinician, their experience with the other diseases, not due to the something with the specific to the COVID. So I think that is clinicians' adaptation and rebuilding up of what they knew earlier in general has worked. But tomorrow we may have some antiviral also, but we don't know we will have it. There may be immunomodulator, effective one, but that you can't speculate. So I think, leave aside the speculation, we have to really rely upon, which Professor Bhargav talked, Professor Padmanabhan talked, that age-old public health preventive measures used in the epidemics and pandemics due to respiratory pathogens will continue to be important in the current and emerging scenario. So the measures we will have to really depend upon, use of the protective masks. Again, we talked about physical and social distancing, other hygienic measures, isolation of the infected individuals that have to continue. We'll have to continue that. Effective quarantine of the contacts. Again, this is very vital because that's the time that it builds up. I think these are the measures which you'll have to emphasize in your Jagrukta Abhiyans as the time builds up. But these awareness campaigns will have to be rich in evidence-based content. That is the point which we are talking about. They have to be easy to understand and impact making. Because beside that major things we talked on the top, there are few ingredients only. After that, the person loses the interest. If it's living, you're working in a hospital, you're working in a clinic, you're working in an organization, your needs are different. When you're coming to home, how you sterilize your everything actually. How you sterilize, if you have a mobile phone, what you do with them? If you have got a currency, what you do with them? If you have books, what you do with that? If you have a clothes, what you immediately do with that? See, I think the awareness campaigns will have to be rich in evidence-based content, which Professor Padmanabhan talked about, like a evidence which is emerging, which is the best. Information material will have to, in local languages, should be easily understood by different targeted sections. Information will have to be relevant and futuristic also. Because, if somebody starts manufacturing something, he should have a future. And infrastructure, human resource requirement and utilization, that all factors will have to be kept in mind as we evolve as a society. It is not, this pandemic is one example, and this will go away by either killing us or of its own. But the point is, we have to change for the better. So the affordable and relevant to different stakeholders like managers of workplaces. If it is an office to be managed, if it is a place to be managed, what you require there to be, so there is no infection spread there. Social gathering places, the institutions, schools, colleges, clinics, hospitals, labs, homes, hotels, hostels, dormitories, and maybe many more examples. So that means with the major things we talked about, in everybody's situation, what will you use? How will you use? If you want to put equipment somewhere, what type of equipment? Will it, how much, if it's a UV light based system, how it will work? If it is something which draws the air, how it will work? So all these issues will have to be very specifically talked about. I think that's the point which we must keep in mind when we build this Jagrukta Abhiyan. You'll have to have everything for everybody and very specific one, not general. See, the current awareness campaigns, when you think of them, dealing with prevention and management of corona epidemic are quite good actually, but they are for short-term goals. Even if they are working or not working, if say you showed, Ghatak showed you pictures, then many people were not wearing. We are finding the same here also. And they were wearing 1 month back. Then suddenly they started, they're crowding. They were not crowding 1 month back because their thinking is gone. So all these measures, because Prime Minister himself was coming on TV and talking, other people were emphasizing mask force, task force, everybody was talking about. But then they also get busy with something else. They have their own tasks, many other things to do. So ultimately, these messages are getting diluted out. So the tools and approaches which have been recommended by Ministry of Health, other key stake players, they are okay actually. But you like to improvise them and you have to better analyze them, then you keep on changing. So the change of predictive habits will require sustained campaign with efficient micro planning. It will not be such broad-based actually. So the challenge is to keep the reasonably enlightened middle class and upper strata of society that influences the media and opinion, leaders in rural and the semi-urban areas, students, other opinion makers, section of society engaged. So you have to really think of how to keep these sections engaged so that the momentum once gained is not lost. So we need to present and keep on generating data about materials and methods. And many times, from Indian situation, if the study is done in India, is experience from India, that will have a better impact on the people actually. They'll know it is working here also. Their efficacy, the safety, disposal, if you are using something, how to dispose it out. And they should have appealing aspects. So I think the challenge of keeping stakeholders engaged, I find is one of the major thrust areas we should have. Why I am saying it can be built into a mass movement is a lesson from the Swachh Bharat Mission and Swachh Bharat Abhiyan. See, Swachh Bharat Abhiyan campaign launched in 2014 by our Prime Minister is undoubtedly one of the most major social transformation steps of our government. It has gained momentum. Why it gained momentum? It was intense, thrust, participation and monitoring was by Honorable Prime Minister himself, who is a very, very communicative, strongly communicative person. And it is a drive led by a leader who relates with the people. Is a fitting tribute to the memory of Mahatma Gandhi. That's what he intended to do, Prime Minister wanted to do, and it has worked actually. It was expected to have a major dynamics on the transmission dynamics of pathogens like in the GI infections. Now I'll show you a few slides, actually, next 2-3 slides to show that it has worked actually. You come to the next slide. See that this study from the Jharkhand, thinking the rural hamlet of Jharkhand, the 2 blocks in Lohardaga and the Ramgarh districts. Excellent survey done after 2 years of the Swachh Bharat Abhiyan. And 93% people in those rural areas knew about the Swachh Bharat Abhiyan. 60% were participating in it. Within 2 years period, there was 23% decline in the diarrheal attacks in that area. Anemia of 10% in 2 years itself. And then it created a social harmony. That was a different point altogether. Now look at the next slide. WHO estimated the impact of Swachh Bharat Abhiyan. Within a span of 5 years, the WHO's estimates are that more than 300,000 children have been saved from diarrhea. Their lives have been saved from diarrhea and malnutrition. So these deaths have been prevented. Now, how many on the lives, the morbidity part, that's not estimated, but that's the life part. How it has happened is straightly linked to the use of the toilets from 45% to 89%. Straight away. The life saved by Delhi's lives, actual life saves, the economic benefits, the health benefits, immense. Now look at the next slide actually. This is another study done by our colleague by ISRO actually. ISRO has looked at the IDSP data across the country of 2010 to 2018. And you looked at the acute diarrheal disease outbreaks. Between 17, 18, after 15, 16, they started coming down. By 17, 18, the acute ADD attacks were very, very low actually, much to 90% reduction. By 2020, maybe even a 95% reduction. And you look at the economic significance actually of not only saving lives, their health, and you can diversify. You need not spend money on the so-called GI vaccines actually. You cannot, your strategy have to be very different. So a Swachh Bharat Abhiyan, which looks every place looks so healthy, happy, clean. You feel so good about your country. But beside that, the economic and health benefits are already there actually within a span of 5 years. So next slide, please. So what I believe, like the highly successful Swachh Bharat Abhiyan led by our Honorable Prime Minister, this Jagrukta Abhiyan inspired by him, though the focus at the moment is on COVID-19, because that's very nice to be focused on something immediate to show the benefit to the people. But it has a great potential of major social and economic transformation. I said if sustained, I think that will all depend, maybe his might, Prime Minister's might, Prime Minister's direct involvement. He inspires for so many things. But action by all of us, its impact will be beyond COVID-19 on all respiratory infections, which are a cause of immense morbidity and mortality in our country. So I think it is the opportune time to be a part of this Abhiyan Andolan, not with the short-term goals I talked about, but the very long-term goals. So what the NASI and other academies, beside what the Abhiyan has been started, our Andolan, we are becoming part of Andolan. We'll have to organize a number of sessions, symposia, workshops, for looking at the research agenda, what information we have, but we don't have. Because the science bodies should talk science also at the same time also, so that, nobody's talking about that. Because ministry has given some guidelines, they're very general, they're generic. They are on a knowledge which is there over the 100 years actually. But the use of mask, use of social distancing, this was practiced in the swine flu 1918 also. So 100 years back also we talked the same. So that works actually, but that works for a limited purpose. So if we want to change the total country transformation, and which will make the impact on the diseases, our way of living, that I think will have to be, the science has to be built around that. On every step, what is happening? On every step, what is happening? Now, if it's a mask, which mask to use? Now, if it's actually the UV sterilizing equipment for the homes, which one to use? I'm like a Corona when I was seeing in Bengaluru. You come and put everything inside there, but how long you keep it? Can it be everywhere? So what there to be put in the clinics? What's there to be put in the school? What is there to put in the office of a principal? What's to be put everywhere? See, this entire science will need a very specific guidelines based on the data actually. So far, what we came out with was an old experience, known experience, proven experience. A generic experience which worked here also. But everything, the people will not accept that. People will find it stale after a few months. It'll wither away. So that science, creating guidelines, improving guidelines, creating debates, I think that will be the major role which NASI and other science academies will be very suited to play, because of many intellectuals, the thinkers of the country, and their friends outside also, they are part of these academies. So I think we are in the best position to contribute. But then think of the long-term goals, not the short-term goals. Because I tell you, I said the same one, even after swine flu, we responded. But that response hardly lasted 2 to 3 years. And when it comes back again, you go back to 0-1 again. So I think that sustenance of the material, by providing material, providing a thinking platforms, providing an agenda, that becomes a part of the agencies like us and the NASI in particular, where the society is the number one for the science and society. So that's our theme is our Atma is around that actually. I think with these words, I'll come to the last slide, which just to thank you, Jai Hind, for this wonderful opportunity to articulate my views. But I'll always emphasize on a very long-term perspective, because seen a success of Swachh Bharat Abhiyan, this Andolan should be a permanent one. The material has to be provided by us, so the country changes forever. Because earlier, in fact, you're looking at, I'm telling you, within a month, the influence is gone actually. And then people will start dying again, they'll start getting panicky again. I think that's not the response it should be. So we have to sustain it, but providing many other materials, it is not these major 3-4 things. They are within 3-4 things. You'll have to weave in other factors, which are the needs of people. So I think just enough. We have to add on. We have to create more material. We have to create how we should function, and how we relate with the people. Like, if webinars will reach to the people who listen to webinars, but whether those people who listen to the webinars will connect with the masses on the streets, will they connect with the other people on the in other fora? I think that's the challenge which we have to focus on. So socio behavioral transformation as a science, and as a science reaching to the masses, will have to be our focus if we want to make a dent there. Otherwise, our effect will be there, but will be very marginal. Thank you very much, everyone who listened to me, and certainly I'll trying to contribute on this aspect, as with what Dr. Manju Sharma Madam thinks about, and building a long-term agenda for our academy, and also for the building the opinion, reaching to the which Madam is capable of. Yes. Thank you very much, Madam. Padmanabhanji. Thank you all senior colleagues who were listening, and I was seeing many of the faces. I'm fine. You have not seen my face. I'm happy and fine, working well. So that's it.
Thank you, sir, for sharing your valuable insights and giving us quite a useful information on this COVID-19 pandemic with reference to the current scenario of the country, India's response, and under the leadership of Hon'ble Prime Minister, controlling the pandemic very effectively, and relevance of such awareness campaigns, especially to reinforce the importance of such practices, the COVID appropriate behavior, and with the take-off message that while the pharmaceutical and therapeutical interventions are underway, no way out but to stick to these measures, the preventive measures, and opt for a major behavioral transformation, which is only possible by organizing such kind of campaigns, nationwide campaigns. Now, COVID-19 pandemic, as we all have been hearing from long time, that it has really unexpectedly and adversely impacted the entire globe. Our government has also made effective measures for its implementation and control it very effectively. Then our scientists from various reputed institutes like DBT, ICMR, and National Institute of Virology are all in the race to develop a vaccine. But there is still a long road ahead. And till we get a vaccine, there is no way out, but we have to live with the virus and manage it. And management of pandemic is a very vague concept that takes into account various aspects, physical, mental, social, and most importantly, the emotional aspect. So we have to manage it. And of course, these kind of practices are very important till we get the vaccine, as just elaborated by Professor Katos sir. So now we are moving to next lecture to be delivered by Dr. Sanjeev Sinha sir, and he will be speaking on management of COVID-19 pandemic. Sir is an eminent physician and excellent researcher in pulmonary medicine and infectious disease in Department of Medicine, All India Institute of Medical Science, Delhi. He has worked hard to promote the use of technology and leveraging it to help others, and also look forward to bring new cost drugs to India to treat poor patients suffering with tuberculosis. May I request you, sir, to please share your views. Thank you.
Thank you very much for introduction. First of all, I would like to thanks to NASI for invitation, and I would like to also thanks to Dr. Manju Sharma for giving me opportunity to deliver this lecture. So I would just like to share, please, next slide, please. Yeah, so I would like to tell here that coronavirus, that is we call COVID-19, this is coronavirus disease 2019, and it is a viral infection caused by SARS coronavirus 2, and it spreads through droplet and via coughing or through nasal secretions or touching by hand to others, who the person who is infected, he can transmit this disease to others. And then incubation period is around 2 to 14 days. And what data is suggesting, what literature is suggesting, that about 80 to 85% patients are either asymptomatic or they are having mild disease. And symptoms are mostly flu-like symptoms, and the patient can present we see here at AIIMS New Delhi, and we see patient present with high-grade fever. They have symptoms like sore throat, and then they have coughing. Sometimes they have chest pain, and they sometimes if they are untreated, then they can land up to the pneumonia and ARDS. Next, please. Yeah. So I would like to tell here that AIIMS facility for treating COVID patient. We have two separate facility dedicated COVID center. One is trauma center, and that is nearby to AIIMS, and another big cancer hospital near to Gurgaon in Jhajjar, that is AIIMS Campus 2, where we also have around 800 bed hospital, which is dedicated to COVID patient. So these are two big facilities, and in the main AIIMS campus also we are treating COVID patient who are having who are AIIMS employees. We admit them in the separate ward, dedicated wards are there, and we keep them over there. So coming to the prevention. So as said by everyone, there are three key things, like we have to do social distancing, we have to use the face mask, and we have to keep the proper health hygiene, like hand hygiene and respiratory hygiene. So these things are key at the present, because we don't have any vaccine and we don't have any particular drug, antiviral drug, that treat the virus. So at present, we have to keep all the time, we have to keep wearing face mask in terms of other surgical mask or homemade mask or N95 mask. So depend on situation, like if somebody is healthcare worker, then they prefer to wear N95 mask. But in general population, if you're wearing a normal cloth mask or surgical mask, that is enough. So another concept of social distancing, like what is the concept of 2 meters or 6 feet distance, social distancing? That is very important to understand, because these this virus within the droplets that travel through cough. Once patients who are having this virus and cough, then these droplets come into the environment. But due to heavy particle, like their weight is around size around 5 microns, so they do not travel beyond 6 feet. So that is the concept of social distancing beyond 2 meters. There have to be gap between 2 person about 6 feet or 2 meters. Next, please. So just coming to the diagnosis. So I just want to I'll tell you briefly about the diagnosis. What are the various investigation we do to confirm the diagnosis. So here you can see that RT-PCR test is gold standard. And what we do, we take the throat and nasopharyngeal swab from the patient, and then we send it in the viral transport media, maintaining the cold chain to the laboratory. And generally we get the report same day. This is very important names. We get the report same day within 12 to 14 hours. And another very important investigation, and that is helping a lot, as told by Professor Bhargava in the beginning, that CBNAT and TrueNAT. And here also we use throat and nasopharyngeal swab, and we send them to the laboratory. We use gene expert machines which are already available in most of the center for the gene expert testing for tuberculosis. So government is using this these laboratory by Webinar or TrueNet for testing. And third is rapid antigen test by throat and nasal swab. This is also very important test, and this is helping a lot to the physicians who are doing the procedure or surgeons who are doing the procedure. So, or any emergency surgery or any emergency procedure need to be done in hospital. Then we do rapid antigen testing, and if it is negative, then we can go ahead and do the test, do the procedure. So positive predictive value is very high, and test sensitivity and specificity is around 50%. And next is serology, and this is antibody test, and we do in the blood or in serum. And this is IgG test is done for the seroprevalence or serosurvey of the COVID antibody in the population or in the community. So coming to the treatment, so as per Indian guideline, as per our AIMS guideline and ICMR guideline, we have some, as I said in beginning, there is no definite drug or antiviral or vaccine at present to treat the coronavirus or COVID infection. So we have some investigational drugs, which we have seen in several trials. They have found effectiveness against the coronavirus disease. So in India, we have antiviral like remdesivir, and then we have favipiravir, and they are, of course, very important like SCQS, that that is one of the anti-malarial drug, and found very effective against the treatment of COVID infection. And then ivermectin, this is a anti-parasitic drug, and this is also found very effective in COVID-19. So next is immunomodulators like corticosteroid. Corticosteroid data shows that this is one of the important drugs. We start corticosteroid in moderate to severe patients. There is very important role as an anti-inflammatory drug and immunomodulator. And other drugs like vitamin C and zinc also have been seen effective. And tocilizumab, we generally use in the severe stage, and we have found this is anti-inflammatory when IL-6 are high. Then we use this drugs and we found it is very effective. Next, please. So in cases where things like in a moderate to severe disease, if patient is having a suspicion of pneumonia or HRC or CT scan showing consolidation in the lungs, in that case we add antibiotics also. And common antibiotics we use as per guidelines are doxycycline, azithromycin, and injection piperacillin, tazobactam, and then very important drug like no molecular heparin, and oxygen is the lifeline. Like oxygen, when patient is having oxygen saturation less than 94, we start oxygen inhalation, and this is very important and life-saving tool for the patient who are having hypoxia. So next, please. So as per AIMS guideline, we have our own management guideline for COVID-19 that has been made in collaboration with ICMR and Ministry of Health and Family Welfare. And these are we have divided the disease in mild, moderate, and severe COVID-19. And next, please. And what we see in the mild disease, when patient is having little bit symptoms, but is not having very severe symptoms. Patient can present with the shortness of breath, little bit cough and fever, and then patient can have loose motion time. So this type of patient, what we advise, we ask them to do home quarantine or home isolation. If patient is positive for COVID and they have mild symptoms, then they can do home quarantine and they can use home face mask at home, and they can do strict hand hygiene and social distancing at home. They can stay in home in the separate room. They can they can make the distance from the other family members, and they can stay at home. And if any warning signs like difficulty in breathing, and if oxygen saturation is less than 94% in room air, and if they have persistent pain, pressure in the chest, or mental confusion, or develop bluish discoloration in the face or lips, or decrease on urine output, then they have to immediately inform to the doctor, and they, if required, then they need to be admitted. And we generally advise to take a tablet SEQS 400 milligram PD in day 1, and then 400 milligram OD for 4 more days, and tablet paracetamol if they are having fever. Next, please. This is tablet paracetamol 500 milligram per nurses. So there is a group of the patient, we call it high risk group, like if patient is more than 60 years or having underlying coronary artery disease or hypertension, or patient is having diabetes with other immunocompromised stage like HIV or cancer, or patient is having chronic lung, chronic liver, or chronic kidney diseases, or patient who had cerebrovascular disease or neurological disorder, chronic neurological disorder, obesity, or respiratory distress. These type of patients comes under high risk group, and we have to take a special care in these type of patients. And if required, then we need to admit them immediately in the hospital facility. Next, please. So next, coming to the treatment of moderate COVID illness. So when patient is having moderate disease, when patient have respiratory rate more than 24 per minute, oxygen saturation less than 94 in the room air, oxygen support required, if there is a requirement of oxygen, then in those cases, or patient is having ultrasensorium, in those type of cases, we advise them to take the oxygen inhalation, and we immediately start the oxygen and try to maintain oxygen saturation about 96%. And sometimes required, then we give the high flow nasal cannula, oxygen through high flow nasal cannula, and we try to, if patient in the hospital, try to give them awake toning positioning that is going to help to increase in the oxygen level in the body. And we have to do certain investigation, like we keep on doing measurement of oxygen saturation, and we do ECG, we do other tests like blood tests, CBC, liver function, and renal functions, and inflammatory markers. Next, please. So what is the treatment for the moderate disease? We do give SEQS, we give injection remdesivir 200 milligram IV day 1, followed by 100 milligram intravenous daily for 4 days. And then we, very important is steroid or methylprednisolone. If patient in the hospital, then we give them intravenous methylprednisolone for 0.5 to 1 milligram per kg for 3 to 5 days, and then we start tapering as per condition of the patient. And very important, some people use conventional plasma, though it is an off-label drug, but there are certain centers use conventional plasma, and they have found there is some effectiveness of this treatment. Anticoagulation in form of low molecular weight heparin, we need to start immediately. Next, please. So coming to severe form of disease. So once patient is not responding, all the things like they are not responding to oxygen inhalation, they are not responding to antiviral drugs, steroid, then we admit patient in the ICU, and we start this is continuous positive airway pressure, and this kind of non-invasive ventilator support, and if required, then we give the high flow nasal cannula oxygen also. And we immediately start IV steroids, and in the increased doses 1 to 2 milligram per kg per day, and high doses of low molecular weight heparin, and consider intubation if required. If patient is not responding to an IV or a high flow nasal cannula oxygen, then we immediately start. We put the patient on mechanical ventilation, and we follow the ARDS net protocol for the treatment of patient. And if patient is having sepsis, then we start antibiotics, and we continue with the other supportive treatment. Next, please. So once patient is responded, then we discharge from the ICU and keep them in lower down facility. And if patient is not responding, then there is another investigational drug that is called tocilizumab, and we give this drug about 800 milligram per kg, maximum of 800 milligram per day, and if required, then we repeat after 24 hours. So these are some important treatment tools we are using in our centers. Next, please. So briefly, I would like to tell about the vaccines. It is already covered by Professor Bhargava very nicely, but I just want to tell about the BCG vaccine. And this is funded by ICMR under fast track, and the study is going on about 15 centers in different part of country in India, and we have found that BCG protect. And hypothesis is that the BCG protects the vaccinated elderly population, and BCG vaccine also reduced the number of reported COVID-19 cases in country. And the combination of reduced morbidity and mortality makes BCG vaccination a potential new tool for fight against COVID-19. And this is about the revaccination. We are doing the research project where we are taking the patient from 18 to 60 years of age who are having a high risk group like diabetes, coronary artery disease, chronic kidney disease, and chronic lung disease. And we are just giving BCG vaccine in this population, and we are following them up for 9 months, and results are still not, we have not done interim analysis. We are waiting for the results, and will be available within 2 to 3 months. Next, please. So this is ICMR COVID-19 vaccine, and this is like phase 2 trial is completed, and now phase 3 trial is going to be started shortly, as informed by Professor Bhargava. Next, please. So another very important vaccine, that is Moderna trial, or this is done by NIH. Next, please. This is kind of RNA vaccine, and is sponsored by NIH, and this is on the phase 3 trial, and we are expecting that this vaccine will be available shortly in early next year. Next, please. So next is Pfizer vaccine, that is between the Pfizer and German BioNTech, and are teaming up with the antibody and experience synchronous consolidated stage. And this is also under phase 3 trial, and hopefully it will be available by early next year. And this is Oxford vaccine, Chodox vaccine, and this is sponsored by University of Oxford and under phase 3 trial. And India is also part of it, and the India-based company like Serum Institute of India, NASI is also supporting them. And this is under, I think phase 3 is undergoing, and we are expecting that vaccine will be available by early next year. Next, please. Yeah. So this is a Russian vaccine for COVID-19. And Russia said that vaccine has proven efficient during tests, offering a lasting immunity from the coronavirus. Russia is the first country to register a coronavirus vaccine, but there is a lot of speculation, like however, questioning that decision of register to the vaccine before phase 3 trials that normally lasts for months and involve thousands of people. So they have started, like, they're giving the vaccine in phase 2, and they have cut down the phase 3. But we have to just wait the report, detailed report, and then we can say about this. So take-home messages are key for the prevention is using of face mask, keep social distancing more than 2 meters, and then hand hygiene, do proper hand hygiene either using by soap and water or by using by hand sanitizer. And then SCQS, role of SCQS is important. And there's we have seen the viral clearance in early disease is good. And then next is remdesivir, and this is also important. And role of oxygen is very important. There are two very important things for the treatment of COVID. One is oxygen therapy, early starting of oxygen, and steroid therapy. Next, please. So just role of vitamin C and tocosamide is also in the early treatment is useful. And with this, I would like to thanks to everyone for patiently listening, and thanks to NASI for inviting me for this lecture.
Thank you, sir, for sharing your expertise and explicating on various sectors of the COVID-19 pandemic, including the prevention of disease, diagnostic and therapeutic part, with mention of various investigations and the treatment part also, and roles of immunoregulators and guidelines for 3 stages, mild, moderate and severe, and also mention of certain vaccines which are under trial, and with the most important take-home messages that, as has been earlier said, to stick with the COVID appropriate behavior by following the 3 key messages. Now, COVID-19 pandemic is the biggest story of our generation and probably the greatest challenge after the Second World War. But there were many pandemics that we came across, but since 1920, there was much advancement in medical science in case of testing, therapeutics and investigations. So with this pandemic, the mortality rate was low. And various facts we will be coming to know from Honorable Professor H.N. Verma sir, who will be talking on a very important aspect, COVID-19 pandemic, some facts. Sir is the Honorable Vice Chancellor of Jaipur National University. Earlier, he was the Professor of Botany, Dean and Pro-Vice Chancellor at Lucknow University. He has been a member of various academic bodies. He is a Fellow of the National Academy of Science and also a recipient of Birva Sahni Gold Medal and several coveted awards. With this brief introduction, I request you, sir, to please share your views and enlighten us with your expertise. Thank you.
Thank you very much, Dr. Rachna, for the introduction. I must thank Dr. Manju Sharma, the driving force behind this.
Sir, your voice is not clear, sir. Please speak a bit loud, sir, if possible.
Okay. So I must thank the NASI and Dr. Manju Sharma, who is the driving force behind all these activities. And this activity which she has planned, Jagrukta Abhiyan, perhaps is very important in the current situation. I am highly grateful to our President, Dr. Padmanabhan, that he has given me this opportunity to talk to you today. I think much has been said about the COVID, and what I was going to say that has already been said by the learned speakers earlier. So I would be touching.
Excuse me, Professor Verma, your audio is not very clear. I think you do some, and you shift a bit in the center, so we don't want to see half of your face. We want to see full face. That's better. ऑडियो जरा ठीक कर लीजिए.
Hello.
हाँ अभी क्लियर आई बस.
Am I better now?
हाँ ठीक है सर.
So much has been said about the COVID
सर अपना अपना ईयरफोन हटा दीजिए. ईयरफोन हटा दीजिए तो वॉइस क्लियर होगी. ईयरफोन से वो
Is it okay?
यस
हाँ
सर.
अभी ठीक है.
Hello?
Yes, yes.
Is it okay now?
हाँ हाँ हाँ.
Yes, now you are clear. Please speak a bit loud, sir. That is all.
Is it okay now?
Yes.
Okay, so I will be touching only a few points which have not been touched till now about this COVID issue, because what has been said about the COVID and all the aspects. One thing which I wish to convey is why this particular virus, COVID-19 disease, which is caused by SARS virus, is so deadly, and why we don't have, we are so concerned about it. Now, one thing which is very interesting about this particular virus, that this virus has an enzyme which is present on the surface, and this particular enzyme, this allows the virus to modify itself and its genetic RNA, so that when it enters the cell, it becomes as if it is a part of the host system, and that is why the antibodies are not able to react with this virus, because it becomes, it takes the host cell into accepting the virus as a part of itself, not as an outsider, and thus it pulls the host cell, and the modified viral messenger RNA is now considered as part of the cell's own code and not foreign. That is why that this difficulty is there. And then regarding the spread, I think much has been said about it. But one thing which I would like to focus is what is the impact of the virus when we are indoors, whether we are conducting a meeting in a room, whether we are sitting in a classroom, whether we are visiting some restaurant, or whether we are at some crowded places, because that is very important. And I would like to share a few slides regarding this, because this has not been touched upon by any of the previous speakers, because indoor spaces are dangerous, and mask and ventilation can help in taking the spread of the virus from one individual to the other. And in that case, the risk of the contagion is highest in the indoor atmosphere. So we have to think about it, because we are soon going to open the schools, the colleges, as well as the restaurant and lecture halls. They have already been opened, but what are the risks involved in these all cases that I would like to show you, because I recently only yesterday I came across the presentation and have taken some slides from there to show you that what are the serious consequences when we are going to such places. So can I share? I would like to share slides, because it is the aspect which has not been touched till now. Other aspects they have been very well covered, and what are the impacts and what are the consequences of the Dr. Sinha, he has talked about the various aspects of the Dr. Bhargava about the development, and Dr. Satosh also about the social issues. So this is one of the issues which I would like to share with you. The new series of visualization by the graduate publication help us show the likelihood of COVID-19 in three major indoor settings: standing in home, sitting in home, going to a reduced capacity restaurant, or sitting in the classroom. So this is very important, because we are going to start the face-to-face classes in the schools as well as in the university also. The restaurants, they have also opened now, and in homes also I now see that many people, they have started visiting the various relatives now. They are visiting the homes also, so they have to be a little bit cautious about what may be the consequences. All three scenarios have direct outcomes, but the visualizations based on research at the University of Colorado show how wearing masks and improving ventilation. This ventilation part has not been taken care of earlier, so this is a very important part. Even when I sit in my room in the office here, I keep my windows open and the exhaust fan on. So this is very important. That doesn't allow the accumulation of the virus into the environment. Ventilation can protect most but not all of the people present. All three scenarios are based on the same premise. A bunch of people are in a room and one of them is infectious with the coronavirus. In the meeting, we don't know who is carrying the coronavirus. He may be asymptomatic also, he may be also. We are not, we don't know about it, so we have to be very cautious in the such a situation when we are conducting this or when we are collecting at some places. The risk of contagion is highest in indoor spaces, but can be reduced by applying all available measures to combat infection via aerosols. Here is an overview of the likelihood of infection in three everyday scenarios based on the safety measures used and the length of exposure. This is a social gathering in a living room, but this is very common. Now people have started visiting their relatives, their friends, and so on. They are going to the offices also. So 6 people get together in a private home, one of whom is infected. The red one is the infected one, and some 31% of coronavirus outbreaks recorded in Spain are caused by this kind of gathering, mainly between family and friends. Irrespective of whether safe distances are maintained, if the 6 people spend 4 hours together talking loudly without wearing a face mask in a room with no ventilation, 5 will become infected according to the scientific model explained in methodology. So 2 things are very important. One is the ventilation, and the second is for how long you are there in a place. That's it. These 2 things are very important. If face masks are worn, 4 people are at risk of infection. Mask alone will not prevent infection if the exposure is prolonged. So you have to keep in mind that the exposure should be as minimum as possible. The ventilating space and reducing duration, these 2 things are very important. The risk of infection drops to below 1 when the group uses face masks, shortens the length of the gathering by half, and ventilates the space used. This is the situation when you have such a space for these precautions. The coronavirus is spread through the air, especially in indoor spaces, by aerosols, tiny contagious particles exhaled by an infected person that remain suspended in the air of an indoor environment. How does the transmission work? And more importantly, how can we stop it? That is the next important point. This is how when an infected person is sneezing or coughing, then the aerosols they spread at the droplets, they spread in the environment. At present, health authorities recognize 3 vehicles of coronavirus transmission. The small droplets from speaking or coughing, which can end up in the eyes, mouth, or nose of people standing nearby. Contaminated surfaces, might, although this is the least likely way of spread the virus. Finally, there is transmission by aerosols, the inhalation of invisible infectious particles exhaled by an infected person that once leaving the mouth behaves in a similar way to smoke. Without ventilation, aerosols present in the air and become increasingly dense as time passes. Shouting and singing in indoor poorly ventilated spaces over a long period of time also increases the risk of contagion. This is because speaking in a loud voice releases 50 times more virus-bearing particles than when you don't speak at all. The aerosol is not diffused through ventilation, become increasingly concentrated, which increases the risk of infection. These particles breathe into the atmosphere with simply breathing and escape from improperly worn face masks can infect people who spend more than a few minutes within a 5-meter radius of an infected person. For example, I have shown here that the duration is 2 minutes, 15 minutes, and 1 hour. What is the effect of the infection? An article which appeared in the Times found that there is overwhelming evidence that airborne transmission is a major transmission route for the coronavirus, and under certain conditions they seem to have infected others who were more than 6 feet away. These transmissions occur within enclosed spaces that had inadequate ventilation. Sometimes infected persons were breathing heavily, for example, while singing or exercising. In a bar or a restaurant with reduced capacity, this is the situation. In this restaurant, capacity has been reduced to 50%. There are 15 patrons and 3 members of the staff. The windows are closed and there is no mechanical ventilation. And in the worst case scenario, no measures are taken. 14 of the customers will be infected after 4 hours. If masks are consistently used, the risk of infection falls to cases. If the premises are made, it can be done with a good air conditioning unit, and the time is spent in the restaurant is shortened. There is only the risk that one person will be infected. Now the school, which is very important, to account for 6% of coronavirus outbreaks caused by Spanish health authorities. The dynamics of transmission of aerosols in the classroom change completely depending on whether the infected person or patient zero is a student or a teacher. Teachers talk far more than students and base their motives to the earth, which multiplies the expulsion of potentially contagious particles. The population and infected for the student will only speak occasionally. According to the Spanish National Research Council guidelines, the Spanish government has recommended that classrooms be ventilated. It is very important, even though this may cause discomfort in the colder months or for ventilation in use. The riskiest scenario is a classroom with no ventilation and a teacher facing risk zero and an infected person. If 2 hours are spent in the classroom with an infected teacher without taking any measures to counter the number of aerosols, there is a risk that up to 12 students could become infected. If everyone is wearing a face mask, the number that could become infected will drop to 5. In real outbreaks, it has been noted that many of the students could become infected irrespective of their proximity to the teacher, as the aerosols are distributed randomly around the unventilated room. If the room is ventilated during the lesson, either with fresh air or mechanically, and the class is stopped after an hour in order to completely replace the electricity of chemistry. So the classes they should not be for very long duration, they should be 45 to 15 minutes. For example, how the risk of contagion can be lowered by changing conditions to have control. All possible preventive measures need to be simultaneously applied: correct ventilation, shortening of the encounters, reducing the number of participants, and wearing face masks. The ideal scenario, whatever the context will be outdoors, where infectious particles are executed. The very pertinent with regard to the understanding the dynamics of indoor transmission was required rehearsal in Washington State. I'll give you one example. Only 61 of the 120 members of the choir attended the rehearsal. At first, we were made to maintain a safe distance and hygiene measures. There was a maximum risk scenario: no mask, no wearing space over a long period. Just one infected person passed the virus on to 50 people in the space of 2.5 hours. Some of those infected were 14 meters away, so only aerosols could explain the transmission. 2 of those who caused the virus died. That was very unfortunate. despite spreading to areas increasingly appear to be critical to the development and spread of the pandemic, meaning that having tools to prevent mass transmission has been to controlling it. It is very important in the balance function. There are no balance functions are there. So these are some of the issues which I have highlighted because they have not been touched by the others. Otherwise, other measures have been suggested. Obviously, they have to be followed. But since we are opening the schools, the restaurants, the bars, and the marriage halls, so one has to be cautious about these things, and one has to wear the mask as well as follow the guidelines that they cannot be there for a long period of time, and they should not be in contact with each other. So this is how we can minimize the risk of COVID pandemic. This is for the general medicine, and which I think I have some articles which I created. Thank you very much, and thank you Nasi for giving me this opportunity to share with you some of my thoughts regarding the COVID pandemic. Thank you very much.
Thank you, sir, for elaborating on the various facts related with the spread of the disease and taking into account all the factors like most importantly with emphasis on transmission via aerosols and the risk factors that contribute to the transmission of the contagion and also the measures that need to be taken for contain the spread of the virus. And most importantly, as always, the key message is that we have to wear a mask, maintain a physical distance, and also maintain a hand hygiene. Now, till the vaccine is developed, there is no way out but to manage with the virus, and that is why the National Academy of Sciences India has launched this nationwide campaign, mass campaign, under the chairmanship of Hon'ble Madam-Dr. Manju Sharma'ji, and also with concerted efforts of our Honorable President, sir. So the only way is to prevent the diseases. Now we have Dr. Ashish Chandan sir with us at NASI headquarters, Prayagraj. Sir is senior pulmonary physician and early professor at Motilal Nehru Medical College, Prayagraj. He has outstanding research contributions in the field of pulmonary research, tuberculosis, and sleep apnea. Now we request Dr. Ashish Chandan sir please share your expertise and enlighten us. Over to you, sir.
Thank you, ma'am, for the nice elaboration. At the outset, I'm very thankful to NASI, especially Professor Dr. Manju Sharma, ma'am, Dr. Neeraj Kumar, and the team of NASI, Dr. Padmanabhan sir. I had been listening for last 2 hours and excellent presentations by the galaxy of the scientists and the Nobel laureates. And it is blessing of God that I am here and I have been invited to present the prevention and precaution in COVID-19 pandemic. My half work has been done by excellent presentation from Dr. Sinha sir and Dr. H.N. Verma sir, who have elaborated very, very nicely on the subject of the prevention in the COVID-19. The coronavirus is a group of viruses named for the club-shaped protein spices, and they protrude from the viral surface and create the appearance of a crown, which is viewed by an electron microscope like this. So the presentation of the symptoms has already been beautifully elaborated by Dr. Sanjeev Sinha sir, and these causes the disease, which may be mild, moderate, and severe. And we have been listening to the talks and all the facts regarding the usage of the masks. The mask has to be worn for the protection. how to protect ourselves from the disease, how to protect the mankind, how to protect this whole of the earth from this deadly disease. So what is a mask? The mask is basically medical masks are defined as surgical or procedure masks that are flat or pleated. They are affixed to the head with straps that go around the ears or head or both. So we see different types of masks like fabric masks which can be created or made at home. Then triple layered masks or the surgical masks, what we call. And then there are respirators or the N95, which we have been hearing for last more than 7.5 months that the N95 mask to be worn in. So, what are the recommendations? What does the world body recommends? The CDC or the Center for Disease Control of America recommends that people wear masks in public settings, like on public or mass transport, at events and gatherings, and anywhere they will be around with other people. And masks may help prevent people who have COVID-19 from spreading the virus to the other person. So masks are most likely to reduce the spread of COVID-19 when they are widely used by people in public settings. So when you are out of your house, you have to have a mask. Mask should not be worn by children under the age of 2. That is to be noted that under the age of 2 or very small children should not have the mask. Or anyone who has trouble breathing, who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. So it has to be noted that in these special circumstances, the mask should not be worn. Otherwise, there are a lot of difficulties. So the mask can be as simple as this. This is called the surgical mask, where you can wear it from the ears, or there is a strap which can be put it from the head and the over the ears. And these are the depictions from the homemade fabric masks, which the recommendation is that the common people should wear once they are moving out of their house. Then there are special masks which have valves or vents on them. The purpose of valve mask is to keep respiratory droplets from reaching others and to aid with the source control. The mask with one-way valves or vents allow air to be exhaled through a hole in the material, which can result in the expelled respiratory droplets that can reach others. So this type of mask does not prevent the person wearing the mask from transmitting the COVID-19 disease to others. Now, what does that really mean to us? This means that these masks are leaky and they can spread the virus from those holes or those vents or those valves, and they should not be used. And the Indian government and the ICMR has also refused that they should not be used for the purpose of prevention. These are these sorts of masks where you have a valve placed over it, or on the sides. It can be on the sides, it can be on the front. So these sort of masks should be avoided as far as possible. They should not be used. Now these are the respirator or the N95 masks which should be used by the healthcare workers, by the doctors who are attending the COVID-19 patients or who are attending the patients suspected of the COVID-19 disease. Now, these are why they are called respirators, because they can filter out 95% of the viral load. So they are extremely, extremely important. And these are really working as a vaccine in the current era, where they are protecting our all the corona warriors in their duties against the patients and saving the lives of the humanity. So how those masks are worn? So the mask should cover both the nose as well as the mouth, and there should not be leaky. The air should not come out from the sides. The person should breathe from the mask itself, and it should not come from the sides. So use of medical mask can prevent the spread of infectious droplets from symptomatic infected person, and use of fabric mask by healthy people can prevent to only a limited extent the transmission of COVID-19 disease. So it's not a foolproof or it's not a respirator, but it's a common man mask where you can breathe easily out of it, and at the same time you can protect yourself from the viral infection. Now, what are the advantages? The advantages is the reduced potential exposure risk from infected persons before they develop symptoms. So asymptomatic patients, if they are there, then you are protected and you are not at the risk of getting the disease, making people feel that they can play a role in stopping spread of the virus. So it gives you a little bit of confidence. Reminding people to be compliant with other measures like hand hygiene and social distancing, which is very, very important for the control of the pandemic. And masks should only be used by one person and it should not be shared. This is very important. Using a mask is one thing, and the other thing is that it should not be shared, so that the transmission of infection should not go from one person to the other, or if the person is infected, he should not transmit the disease to the other person. So the mask should not be shared. Now, what is the ideal condition or what is the ideal mask? The ideal combination of material for non-medical masks should include 3 layers. The innermost layer should be hydrophilic, which should be from hydrophilic material like cotton or cotton blends. The outermost material should be hydrophobic, like the polypropylene or the polyester, and the middle hydrophobic layer should be synthetic non-woven material like the cotton ones or the polypropylene ones. So that should be the ideal content for the mask which is to be worn by the common people. Now, what are the how to wear a mask? That is of prime importance. You should always know how to wear a mask. Before putting up a mask, you should always perform a hand hygiene and then you put up the mask. Ensure the mask covers the mouth and the nose. I have already shown you the picture. Avoid touching the mask while wearing it. You should not touch it from the front. And remove the mask. Do not touch the front of the mask. When you are removing it, you just untie it from the side layers or these side sleeves which are there over the ear or over the head, and untie it from behind. Please do not touch it from the front because the virus is stuck up on the front part. Drop the mask in the detergent solution immediately once you are taking out the mask from your face, and clean your hands with soap and water or alcohol based hand rub immediately after the after you have taken out the mask. And ideally you should also wash your face with soap and water solution when you take out the mask at home or whenever you return to the home. This is a beautiful slide which depicts that you have to keep safe at your home. अपने हाथों को मुंह से न छुएं और ये बात अपने बुजुर्गों और बच्चों को भी बताएं. So always tell the elderly and the small children that how to wear a safe mask, how to wear a mask, and how to take it out. And you should never touch the eyes, nose, or the mouth when you are handling the mask or you are out of your house. So you should always take precautions when you are putting up the mask and when you are taking out the mask. And when you are discarding the mask, you should always discard it in a safe container so that it is not contaminated. There may be some potential hazards or potential risks of using the mask. What are those? self-contamination due to manipulation of the mask by the contaminated hands. So if you are handling, if you are doing work and you are putting your hands on the mask on the front part, then you can self-contain or self-contamination can be there. Potential self-contamination can occur when soiled, wet or damaged masks are used. How it occurs? When you overuse the mask. If you are using the mask for more than 8 hours, when there is lot of sweat on your face and you are using the same mask, or you are using the mask for pretty long time or maybe days. Few people visit our clinic and they have been using the mask, same mask for so many days, and it becomes dirty and still they are using, and they are always trying to correct the mask with their hands. They are always touching the mask. So that will self-contaminate the with the virus, and you will get the viral disease. Facial skin lesions can be there, irritant dermatitis can be there, or worsening acne can be there with the use of the mask. False sense of security, less adherence to other protective measures can also be one of the significant things when the common public or the public at large is using those masks for the benefits. And another thing is, when you are using the respirators or the surgical mask and you are using it for a prolonged period for more than 4 hours or 6 hours or maybe 8 hours, then you sometimes feel suffocated or stuffed up, or there can be breathlessness also. So when we are talking of the preventive measures, mask is the most important thing. And I think everybody has talked about the mask, about the social distancing, about the hand hygiene, and all those factors associated with this. So that much about the face mask, and now we come to the social distancing part. What is social distancing? Social distancing is also called the physical distancing, means keeping a safe space between yourself and other people who are not from your household. When you are out of the house, you have to practice this social distancing with other people, or when you are in the gatherings. It was beautifully depicted by Dr. H.N. Verma sir in his slides, where he elaborated whole pictorial diagrams regarding the social distancing. To practice social and physical distancing, stay at least 6 feet or 2 arms length from other people who are not from your household in both indoor as well as outdoor spaces. So social distancing is also very, very important parts. Another thing is, people sometimes use the face shields. We'll come to face shields later. First, let us have the social distancing part, that you have to always wear a mask and you have to always have distance. Previously, that this should be the classroom like, where the students should put up the mask, there should be social distancing, and there should be well ventilation of the classrooms. So COVID-19 spreads mainly among people who are in close contact, less than 6 feet, for a prolonged period, which has been previously told, that if you are sitting with the other persons for a prolonged period, maybe 2 hours, 3 hours, then you are likely to have an infection which will spread. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land into the mouth or nose of other people who are in the vicinity. The droplets can also be inhaled into the lungs, and recent studies indicate that people who are infected but do not have symptoms, they also are likely to play a role in the spread of COVID-19, what we can say as asymptomatic carriers. And since people can spread the virus before they know they are sick, it is important to stay at least 6 feet away from others as far as possible, even if you or the other person do not have any symptoms. So that is very, very important. Then the other thing, which the slides have been somewhat here and there. Then the other thing is face shields. What about the face shield? A face shield is primarily used for eye protection for the person wearing it. At this time, it is not known that what level of protection a face shield provides to people in the nearby from the spray of respiratory droplets from the wearer. This is currently not enough evidence to support the effectiveness of face shields for the source control. And CDC does not recommend use of face shields as a substitute for mask. This is very, very important, because if you are wearing a face shield, should not think of that only face shield is good enough or it can protect. So you have to have a mask before putting up a face shield. Wearing a mask may not be feasible in every situation for some people, like those who are deaf or hard of hearing, or those who care for or interact with person who is hearing impaired. So there you can use, in special circumstances, you can use face shields, because they can have difficulty in lip reading. They will not be able to understand what the other person is saying. So individuals who must wear a face shield instead of a mask, then face shields, although there is evidence that face shields protect limited, or the protection from the face shield is limited, the available data suggests that the face shields that wrap around the sides of the wearer's face and extend below the chin, they can be better, and the hooded face shields are better as compared to the non-hooded ones. The face shield wearers should wash their hands before and after removing the face shield, and avoid touching their eyes, nose and mouth when they are removing it, just like the face mask, as I have already elaborated. The disposable face shields should only be worn for a single use and disposed of to the manufacturer's instructions. They should not be used again and again. Reusable face shields should be cleaned and disinfected after each use according to the manufacturer's instructions. And plastic face shields for newborns and infants, they are not recommended, so they should not be used. Then about the hand hygiene, how to go about the hands, how to wash your hands. Everybody says about the hand hygiene, and soap and water used for the hand hygiene is the single most important factor for controlling any viral infection. We had learned from the swine flu pandemic that hand hygiene is the most important part. And how we do it, there are steps to do it. We have given a small name, Suman K. And what is this? Suman K means you rub the palms together, matlab samne samne, then rub the back of hands, ulta, seedha, ulta, then muthi. You can see in step 4, you see this is muthi being rubbed against. Muthi being rubbed against each other. Then A stands for angutha, clean the thumb, then rub the finger tips or fingernails, and K stands for kalai. So seedha, ulta, muthi, angutha, nakhun and kalai. This completes the washing of your hands with soap and water. Use liquid soap, which is preferable, but any soap will do. So wash hands with soap and water for at least 40 seconds. Alcohol-based hand rubs or sanitizers can be used in place of soap and water if it is not available. Minimum 70% alcohol-based liquids to be used for minimum 20 seconds. And the process will be same, seedha, ulta, muthi, angutha, nakhun, kalai. Frequent hand washing to be done mostly on hourly basis. That is very important. So very frequent washing should be done if you are out of your house. But how long can the virus live on the surfaces? Dr. Verma has beautifully elaborated that why 6 feet and why we are talking about the 2 meter safe distance between the two persons. Because besides direct person-to-person transmission, virus particulates from one person can land on a surface and later be picked up by another person. So, one study has found out that virus in aerosol form can survive for 3 hours floating in the air, but being a heavy virus, it settles down on the surfaces. So this study also suggests that virus can live up to 3 days on plastics and stainless steel surfaces and can survive on the clothes for more than 24 hours. So we need to have infection preventive protocols, and for that we need dust mops and mopping, sweeping, cleaning, and cleaning which contains either alcohol based things or chlorine based things, where hypochlorite solution 1% or 0.5% is significant. If we are using hypochlorite 1% solution, that is fair enough, and that can mop up all the areas including the surfaces, including the floor areas and all the corners of the room and the indoor things and articles for the home-based use. So 1% hypochlorite is there. It's fairly enough. And it has to be done twice. घर रोज 2 बार फ्लोर क्लीनर से पोछा लगाएं. So that which contains the hypochlorite is the best. टीवी का रिमोट, फोन, लैपटॉप आदि को रोज कम से कम एक बार जरूर सैनिटाइज करें. और इसको सैनिटाइज करने के लिए यू कैन यूज आइदर अल्कोहल बेस्ड और hypochlorite based cleaning solutions which are diluted and they are made up to 1%. Whenever you are visiting your home after going out for anything, including offices, markets, anything, then you put all your clothes into the washing machine or into the detergents. तो ऑफिस या मार्केट से आने के बाद अपने पहने हुए कपड़ों को धोने के लिए डाल दें और अपने हाथों को और पैरों को अच्छे से धोएं, including your face. A lot of people ask me about the guidelines for room air conditioners, whether it should be used, whether it should not be used. So the central air conditions or the central coolings should not be used. They are not permitted unless there are negative pressure chambers. So set room temperature between 24 to 30 degrees. If you are using the ACs, which are window ACs, maintain relative humidity between 40 and 70%. And in dry climates, do not allow relative humidity to fall below 40%. Ensure adequate room ventilation. So we always advise all the people to have open windows and open doors, even if you are using the air conditioners. That is foremost important. The cooling will be little bit on the lower side, but it will not have that much impact on the transmission of virus as compared to the normal closed doors, where you will be able, you have the chances of getting infection by more than 80%. So how can I protect myself? Sanitize. Hand wash often with soap and water or alcohol-based sanitizer, social distancing, and avoid touching your face with unwashed hands. So that is very, very important. Try to greet the patient like the namaste and other conditions where you don't have any physical contact. So the graph has to be flattened, and we are moving towards it. I have just read today only in the newspaper that the cases have markedly dropped in our country. That is a very, very good thing, and it is because of everybody is contributing towards it. So how can I keep from spreading illness to others when I am sick? What are the things to be done? Stay home when you are sick. Cover your cough or sneeze with a tissue then throw the tissue in the trash. Regularly clean and disinfect frequently touched objects and the surfaces. Call ahead to a healthcare professional if you develop fever and symptoms of respiratory illness such as cough or difficulty breathing. And prevent COVID-19. Safest thing is avoid physical contact when greeting. Safe greetings with a wave, a nod, or a bow, and avoid personal contacts. So that is how we'll stay safe, and together we can win this pandemic. Thank you all for the patient listening.
Thank you, sir, for sharing an in-depth information on very basic but very crucial facts on the prevention and precaution and prevention of the disease, the COVID-19 pandemic. And we always know that it's always prevention is always better than cure. And also, sir told very nicely these things as per the recommendation of the Center for Disease Control. And so if we follow these basic things, but very important things, we can definitely do our bit in reducing the viral load to some extent. And with this, we come to the end of the webinar, which was organized on the occasion of the launch of this COVID-19 Jagrukta Abhiyan for the COVID-19 pandemic. And it is expected that we learned a lot from the eminent speakers. And we hope that NASI has already taken a lead to propagate the message as part of its Science Society program and definitely play a lead role. Now, with this, I request Dr. Neeraj sir, the Executive Secretary of NASI, to please propose a vote of thanks.
Before the vote of thanks, I would like to invite Madam Manju Sharma'ji to say a few words as her kind blessings.
Thank you, Neeraj. I think all of us would agree that this was an excellent session, and for almost 3-4 hours, we have heard some of the best lectures which we can hear on the whole question of prevention of coronavirus and preventing the spread of diseases. Every speaker, I'm not going to summarize. Professor Balram Bhargava, of course, gave an extensive coverage of the entire operations which are being held in the country. And we got a total picture of how much the government is involved in this preventing the spread of coronavirus, and also taking all the precautions and sort of a proactive measures to develop vaccines, diagnostics. They have now you have heard so many extra laboratories have been created, and like that, the way we have government's initiative has been, which has impacted the entire country. And of course, all this, many of these things are due to the efforts of our Hon'ble Prime Minister, who has been taking several emergency meetings, review meetings, and meeting the scientists, doctors, policymakers, administrators. In fact, the other day when he was giving a national address, he said that even a vaccine distribution plan is under preparation by NITI Aayog, and they have almost decided how will they go about distributing the vaccine as and when it is ready. Now that's a very important step to be taken, and Dr. Padmanabhan raised a very valuable point about the cold storage, that we will not have, if we don't have cold storage, the chain, how will we go about in the whole country? And I think that is a point which has emerged from this, and we will bring it to the notice of ICMR, and they can decide as to how to go about. They are coordinating all these things. Now, both Professor H.N. Verma and Dr. Sanjeev Sinha, it was an excellent presentation as to how, in very simple words, you should prevent the infection, and also what are the various stages, how we go about when the fever comes, all that which was explained, and how do we take the different vaccine doses, when do we come to the steroids, when the oxygen is required. That was very nicely elaborated by Dr. Sanjeev Sinha and Dr. H.N. Verma. Dr. Katoch explained the whole connection of the social connection of all these efforts what we are making. He explained that the social behavior of the people has to be understood. And I think that is, again, one of the very important aspects. Dr. Ajay Ghatak was remarkable in giving us the input for the distant education. And of course, he has been doing it for so many lectures and events. So, Dr. Ghatak, your work is really going to be very, very useful. I want to also just conclude by saying that we have to, this is the first Jagrukta Abhiyan, and we have to take it in parts of the country. And Neeraj, we have to develop some programs in the rural chowpals also. And you look at what are the most affected regions, like in West Bengal, we have a lot of difficulty. We have in Kerala, and of course Delhi. So we can, in West Bengal, we can request Dr. Amit Ghosh to develop a small program, and he can do it with the help of the local chapter. Delhi, of course, Dr. Ajay Ghatak will always do, and we have already done one, and we can always repeat. I have requested Professor Padmanabhan, I have requested Rangarajan to think if we can have one in Bangalore or in the southern part. So Rangarajan is going to get back to me after consulting Dr. Ashok Mishra. And one I wanted in Uttarakhand, that is the hill region, and again I have requested UCOST. We have made a request to all the local chapters also. So this message has to now go across, and we don't have to be complacent of the fact that the cases are coming down. That's because we still don't know what will be the situation as we go into the winter months. So we have to be very, very careful, and we have to, at this stage, if we can hold on to all these preventive measures, the three of them most important, mask, hand cleaning, and social distancing, I think we can go through the whole epidemic once again if it comes, or even when if it is slowing down, we can prevent more deaths, more morbidity, and more fatality in the country. So overall, NASI is going to, with the approval of our president, he has already approved that we should go ahead with this activity. We should have at least 6-7 more such programs before the end of the financial year, that is in March. Let us see when the vaccine will come, then it will be a different aspect we'll be covering. But at the moment, we have to go with these three main objectives. So I thank all the speakers, very, very distinguished speakers, and Professor Padmanabhan, thank you so much for your all the support, your approvals you are giving. Absolutely, you send the mail to him, within 5 minutes it comes back, approved. You can do this with suggestions. So Professor Padmanabhan, you have been really anchoring all of us to get the program spread really fast, and we will make our best efforts to do so. Maybe after some time, Dr. Ajay Ghatak will have more in Delhi, and where we can have more college students, and we can even put it on the YouTube, and so that many people can watch, many people can question if there are some questions about this. So thanks once again, and thank you, Neeraj, for this excellent coordination, and wish you all the best.
Thank you, madam. Thank you, madam, very much. This is all because of your
Thank you very
guidance and kind blessings that we could organize the things in a very systematic manner. Actually, right from the beginning. On the same day, you started the program when our Honorable PM announced that. So that was really a very remarkable thing. And the academic took a lead in this thing. And already the Mumbai chapter has organized the same program, madam.
Yes,
And we have organized now, and the Kolkata chapter is going to organize on 6th November. So,
wonderful. For sure.
yes, so, yeah. Dr. Hemant Majumdarji and Professor Amit Ghosh is also there, and Sanjeev Dey is also there. They are all organizing this on 6th November. We will send the notices about that on 2nd or 3rd.
Okay.
So,
And
madam,
just a minute, Neeraj. I wanted to ask you that South program, will it be okay? And what would be the convenient time for that?
anytime, madam, before Diwali we can have before 12 or after the Diwali or after 14th.
No, I'm asking Professor Padmanabhan, his convenience.
Dr. Manju Sharma, no, date we can find out. I was thinking in the south whether Mysore would be better, than Bangalore itself. Is there somebody in Mysore who is a fellow?
Yeah.
Who is?
Yes, Dr. Niranjan. He's a very
active
Chancellor,
professor.
very active.
I was wondering, Mysore would be easier to organize. CFTRI is there.
All right. Okay.
I would suggest instead of having it again in Bangalore, maybe somebody in Mysore. Niranjan is a good choice, actually. He would be happy. I was wondering whether that can be done.
Rangarajan can help because he knows the entire system.
He can help, right? Yeah.
Help. So, okay, we'll do it in Mysore and I'll ask Dr. Niranjan to deal with it. And Dr. Verma, Professor H.N. Verma, can you do one in Jaipur, Rajasthan? Because Dr. Katoch is there, you can take his help. Kiranji is there, his wife. H.N., can you listen to me? You're not listening? No, he's not. Okay, doesn't matter. I'll send a mail.
Listening to you.
Echin, can you hear me?
Yes, I can hear you.
Okay, I was just requesting you whether you can organize one with the help of Dr. Katoch and Kiranji, his wife, in Rajasthan. Huh? Okay. Yes, you can do it. And Paramjit, I see you. Do you have any more suggestions that we should have in Delhi one and one or two? And you want to say something?
Maybe we could have one in Northeast also. Dr. Joshi is very active worker.
Yeah, you are right.
So he should also organize it at many places, whichever is suitable to him.
We'll ask Dr. S. Oh, Joshi is here.
Yeah, I'm here. Namaskar, madam. I'm here also. We could do one in Northeast also, as Professor Madam Purana suggests.
Perfect. We will plan. So, Neeraj, are you making a list of all the suggestions?
Yes.
Okay. So, yes, Neeraj, you can go ahead now.
Okay, now the actually major part has been done by yourself, madam. Actually, I just wanted to thank all the eminent speakers and the eminent fellows and members who participated in this program, especially our Honorable President, who gave a clear nod to this program, and with his inspiration, we could organize this program. So we are very much grateful to you, sir. And this program, actually, like every program, Professor Ajay Ghatak, sir, is always available to help us in coordination, in making it beautifully arranged. And this time also, he became a speaker himself as to make it known that how the webinars and several things could be instrumental in disseminating the message and the awareness program. We are very much thankful to you, sir. Also for giving your time today. And Professor B.M. Katur sir, who is so experienced person, our chair also, NASI chair also, and former secretary. Actually, his experience and also the experience of his wife, Professor Kiran Katur ji, that has led many programs in the Rajasthan area and other areas also. So we expect that much more coordination and help will be given by him. He will extend his helping hands to organize the programs in the Rajasthan areas. So we are very much grateful to you, sir. And his speech was also in a very different way, that it was on the adoption of all the strategies with our socio-economic background, how to penetrate the them. And that was very good. That was very enlightening. So we are very much thankful to you, sir. And Dr. Sanjeev Sinha ji, actually, as his past duty, he gave the whole account of the treatment, various kinds of treatment, which are supposed to be given by an eminent doctor or the doctors to these poor fellows who are being infected by the COVID-19. But they are poor because they are being infected, but because they are not poor, that we should make the social distancing. Physical distancing is okay with them, but there should not be social distancing with the COVID-19 patients. And Professor H.R. Verma sir gave a very good account with the pictographic details of the social or physical distancing and how it is going to affect our age. This was really a very good illustrative demonstration of how the infection could pass on to the others. Thank you, sir, very much. And Ashish Tandonji, the local doctor from Allahabad, who is a chest specialist. He is working on many improvements for the patients who are suffering from the COVID-19. So in his clinic, there are several instruments have been arranged, and he is helping the people of Allahabad. So he gave also a very good talk on the social distancing, hand hygiene, and also on the mask and different types of masks. So the whole thing was so enriching, and the message was clear. The PM's message that to Jagrukta Abhiyan of COVID-19 was in true sense adopted by NASI, and that is because of your guidance, madam. And beautifully you have arranged that program. You contacted all the speakers, and everybody gave consent, and now we are able to organize this program. We will also organize several programs under your kind guidance and valuable guidance. Thank you very much, madam. And we have no words to thank you, basically. So we thank also to others who are here. Actually, I cannot take all the names, but our both the general secretaries, Professor Satyadev sir and Professor Paramjit Khurana ji, both of them attended this program throughout. And Professor Kamboj sir, Professor Isar Joshi, Professor Kiran Katoch, Professor Amit Ghosh sir, Dr. Smita Mahale, Professor Anupam Verma, Professor H.K. Majumdar, Dr. Sanjeev Dey, Dr. A.K. Singh, and several other eminent fellows and members of the academy attended this program. We are very much grateful. We are very much, we can't do such programs without their help. So we are all grateful to them, and we wish to pay them regards also for sparing their valuable time and making this program very successful.